Honourable members, the prayer. Lord, the God of righteousness and truth, grant to our Queen and to her government, to members of the Legislative Assembly, and to all in positions of responsibility, the guidance of your Spirit. May they never lead the province wrongly through love of power, desire to please, or unworthy ideas, but laying aside all private interest and prejudice, keep in mind their responsibility to seek to improve the condition of all. Honourable members, please remain standing for the playing of God Save the Queen.
God save our gracious Queen, long live our noble Queen. God save the Queen. Send her victorious, happy and glorious, long to reign over us. God save the Queen.
Please be seated.
Introduction of visitors, introduction of guests, ministerial statements, member statements.
The Honourable Member for Edmonton West Henday.
Mr. Speaker, we are in the third wave of a global pandemic. Over 2,000 Albertans have lost their lives. Thousands have been sick. Our frontline heroes have been working day and night to protect Albertans. Small businesses are struggling. Albertan families are struggling. Albertans need a government with their interests at heart and a commitment to getting them through this pandemic. But instead, all Albertans can see is a government like the Conservative governments of Alberta's past, more focused on nasal gazing and internal drama than the job they were elected to do. This Premier is fighting his party and his caucus when he should be fighting this pandemic with 100% of his energy and focus. His priorities are so backwards that as the third wave loomed over Albertans, he threatened to call an election to stop the infighting in his caucus. This Premier, who brags about the size of his mandate, was sent a letter by the members of his party telling him that he has lost the moral authority to lead them. His members told him that he is such a liability that even when he agrees with them, they can't support him, that he needs to resign. To quote the letter, "Once you have lost trust, it can never return." That is true. The Premier has repeatedly let Albertans down and broken his trust in them during this pandemic. He acts late and does little. He blames others for the failings and mistakes of his government. He told Albertans to stay home for Christmas, but then approved the international vacations of his caucus and staff. Albertans don't trust this Premier or this government. So before the UCP descends into the long-established Conservative tradition of infighting and leadership challenges, I would raise a word on behalf of the Albertans watching from the outside. The Albertans who don't care about the caucus drama and the leadership issues the UCP insists on dragging into the public. They want a government focused on protecting and supporting them through this pandemic, not a government focused on squabbling and petty infighting. And it's clear they won't get that from the UCP. Thank you.
The Honourable Member for Fort McMurray-Lac-La-Biche.
Thank you. I'm honoured to rise and recognize actions Alberta's government has taken to protect access to rural health care. On April 21st last year, the government announced significant investments to address the unique challenges faced by rural communities and rural physicians in providing healthcare services. One of the highlights was to make changes to improve physician recruitment and retention. The $60,000 cap of the Rural and Remote Northern program was abolished, making it one of the most generous of such programs in the country. Rural physicians were exempted from changes to overhead policies, on-call rates for rural physicians were increased, and medical liability rates for all rural physicians were frozen. At the direction of the Minister of Health, a task force was formed to provide advice on issues surrounding recruitment and retention of rural primary care physicians. The Rural Sustainability Primary Care Task Force will provide recommendations to the government by March 31st of 2022. Alberta's government also recently announced a $6 million investment over 3 years to help students pay for their medical school. In exchange, these students will complete residency training in rural Alberta and agree to practice in a rural community once graduated. Alberta Health Services also continues its work to recruit family physicians all across rural Alberta to meet our community needs. Their physician resource planners identify and pursue physician recruitment opportunities and work closely with various community partners and organizations to recruit our physicians. Partners include local health councils, Rural Health Professional Action Plan, and independent physician recruitment and retention committees. Alberta's government is spending about $90 million this year to address rural physician recruitment and retention. Mr. Speaker, I'm proud to be part of a government that is taking real action to protect and improve access to quality health care all throughout rural Alberta.
The honourable member for Airdrie Cochrane.
Thank you, Mr. Speaker. As you know, the oil and gas sector plays a vital role in not only the economic success of Alberta, but all of Canada. On a global stage, our producers are the most innovative and environmentally responsible. Unfortunately, over the course of the last 6 years, we have encountered extreme price volatility, which had a detrimental impact on the viability of many companies in our energy sector. Demand for oil will be strong for decades to come, so we need to look to the future to create policy that supports companies to maintain strong ESG track records while upholding a competitive investment environment. One such proposed program is called R-Star. R-Star was designed to incentivize cleanup of abandoned wells while encouraging future capital spend. The concept is simple. Upon completion of a well abandonment and receiving a reclamation certificate, companies earn a future royalty credit based upon a well site's liability value as predetermined by the Alberta Energy Regulator. Rather than using a heavy hand to enforce reclamation, this incentivizes companies to clean up sites while strengthening their balance sheet and providing opportunity for a company to grow organically through investment in new production. And the beauty of R-Star is that credits can only be redeemed right here in Alberta, which means an economic benefit to our communities and jobs for the hard-working, go-get-em people of this province. Mr. Speaker, I'm encouraging all members of this House and the community at large to support R-Star, and I encourage industry advocates like SANE to keep putting forward proactive ideas like this one. I'm proud to be part of a UCP government that demonstrates strong support for environmental stewardship and has an eye on the horizon for the future success of this great province. Thank you, Mr. Speaker.
The honourable member for Edmonton Highlands Norwood.
Happy Earth Day. Sadly, if the UCP had it their way, Earth Day won't be a happy day for long. And before I get accused of exaggerating, let's consider the vision the UCP has for our beautiful planet. The gorgeous eastern slopes of the Rockies will be ugly, gaping holes destroyed by open-pit mining. Animals and plant life will be at risk because the proposed mine sites are vital natural areas for so many species. The water supply to various parts of Alberta, including traditional treaty territories, will be ruined. I don't know about you or the rest of Alberta, but I prefer my water without toxic chemicals. And on this Earth Day, I'm so grateful to the countless Albertans from all over this province who rose up in protest of the UCP's reversal of the Lougheed coal policy. And I'm so grateful to the Niitsitapi water protectors and all those who've demanded better for future generations. We cannot depend on this government to prioritize the planet. This is the same party with climate change denying MLAs and whose federal counterpart voted against officially recognizing climate change. Never mind all the research and the science proving otherwise. Look, if you want to enjoy the great outdoors, you cannot count on the UCP, because when they're not pushing policies that destroy the great outdoors, they're making it harder for all of us to enjoy them. This pandemic has taken a lot from Albertans. For many, camping was one of the few affordable activities that they can access. But at a time when many Albertans are struggling, the UCP decided to jack up park fees. Albertans have been camping on Crown lands for generations, but those lands and others remain in jeopardy. This government only backed off on their plans to sell parks after all of you spoke out. So while I stand here worried about this section of planet Earth that we call Alberta, I know that there's a better way. You've all shown that you're not willing to accept a government that prioritizes profits over our planet. Keep speaking out, keep pushing back, and keep fighting so that we can celebrate Earth Day, not just today, but every day.
The honourable member for Sherwood Park.
Thank you, Mr. Speaker. Today I'd like to rise to proudly to discuss some of the achievements our government has made in helping to fuel the success of Alberta's industrial heartland. Alberta's industrial heartland, or AIH, is the largest industrial area in Western Canada and includes my community of Strathcona County. It is home to more than 40 petrochemical companies and is one of Canada's largest petrochemical processing regions. The Government of Alberta has been proud to partner with the Alberta Industrial Heartland Association on a number of initiatives over the last several years. As Alberta seeks to diversify our energy sector through initiatives like the Natural Gas Vision and Strategy and the Alberta Petrochemicals Incentive Program, the AIHA has provided key feedback and input as to how Alberta can best move forward in a way that brings businesses and jobs to our province. In fact, a facility in the Heartland region was the first approved project under the Petrochemical Incentive Program, supporting over 16,000 jobs during construction and a further 300 once the project is complete. This facility is a $4 billion plastic production plant owned by Inter Pipeline that is currently under construction and will receive $408 million in grant funding to help bring new value to the region's petrochemical sector and expand the range of products capable of being produced in Alberta. This is just one of many recent projects that will help Alberta's industrial heartland to become even more of a powerhouse in the global petrochemical market, all while helping the economy of Alberta. Thank you, Mr. Speaker.
The honourable member for Edmonton Whitehead.
There's an important conversation happening in Alberta and across the country right now about childcare. But that conversation must be based in facts, not scare tactics. So let's talk facts. The UCP says only 1 in 7 Alberta families choose licensed childcare. Fact, there are only enough licensed childcare spaces for 1 in 7 Alberta children. Imagine how many parents would choose licensed childcare if there were enough spaces where parents need them and at a cost that they could afford. That, Mr. Speaker, would be parent choice. The UCP says affordability is not a major issue for parents. That explains why every action they've taken, including ending the $25 per day pilot program, has made childcare more expensive for Albertans. Fact, the average cost of childcare in Alberta is more than a mortgage payment, and 40% of Albertans report affordability as a significant challenge in finding childcare. The UCP says the federal childcare announcement is only for, quote, 9 to 5, union-run, government-provided, institutionalized childcare and excludes rural families. Fact, none of those claims are true about the federal announcement, not one. And the term institutionalized is insulting and bears no resemblance to what's actually happening in childcare programs, something UCP members who use licensed childcare know firsthand. The UCP says the federal government should give them the money with no strings attached because Alberta is unique. Well, the UCP might be right about that, but not in the way this government thinks. Fact, Alberta has the youngest population in Canada. The employment rate of Alberta women, who experience the largest pay gap in the country, is now lower than any other province, down to 1984 levels. So we have the greatest need for affordable childcare in the country. Fact, Alberta's current government has gutted the childcare system, which is the biggest barrier to economic growth, increased GDP, and getting women back to work. So yes, Alberta is unique. We are uniquely in need of a government that will do whatever it takes to make sure all Alberta families have access to quality childcare. One last fact, the UCP don't meet that need, and they never will. But that will all change in 2023.
The honourable member for Peace River.
Well, thank you, Mr. Speaker. I rise today to tell the story of one of my constituents. My constituent, Bryce, lives in Peace River, while his son, 15 years old, lives in Yellowknife with his family there. In the past, his son comes down to Peace River every summer, spring break, and most Christmases to spend time and quality time with his family, particularly his father. Throughout the school year, his father would drive up to Yellowknife every month on a weekend to spend as much time as possible throughout the year. Although having a split family can be difficult, this family makes it work, even across a province and a territory. But that was before the pandemic. While the pandemic has the border closures happening in the Northwest Territories, the father and son have been unable to meet in person since August of last year. Strict quarantine rules make it so difficult that the son has a difficult choice if he comes down to Peace River, because he would have to isolate for 14 days upon return to the Northwest Territories. And if the father goes to Yellowknife, he would have to isolate as well, taking time off work, making the financial burden very high. The truth is, in spite of the fact that they FaceTime nearly every day, the distances are very difficult in this family, and the mental health consequences are crushing our communities, and particularly families like this. Even though they would spend time playing crib, fishing, golfing, and camping and canoeing, they can't do that right now. I tell this story because it reflects so many of my constituents and folks across the province, but my constituents have a special relationship with those in the territories, and those border closures are making it very difficult. We have to understand that COVID is not the only concern for health on our communities, and life is fragile. I pine for a time when father and son are reunited. We remember that COVID is difficult, but I know very soon we will have a time where Albertans across the province are reunited with their family.
The honourable member for Fort McMurray Wood Buffalo.
Thank you, Mr. Speaker. What is society's tolerance towards death? When it comes to restrictions in our society and perceived imposition of a government's will on its people, well, it's a debate that's yet to happen. Did you know that life expectancy is greatly improved? Generally speaking, if you're born in 1900, you might expect to live to the age 50. By 1951, it was 68 years. If you're born this year, you'll live to be on average 83 years old. We've beaten or at least been able to control or minimize diseases like diphtheria, measles, mumps, and rubella, polio, elephantitis, cholera, syphilis, tuberculosis, malaria, yellow fever, smallpox, leprosy, diabetes, HIV, and even cancers. We can deal with your obstructed arteries, save you from major trauma, cure your infections, but we've seen a setback this last year. COVID. The question has arisen, how much does society sacrifice to prevent death? Our health system risks overloading because we have the technology and knowledge, but it takes a lot of effort to sedate someone in order to keep them alive while they're intubated and ventilated. Some are using plasma therapy to cure patients. People are on the heart-lung machines using cardiac surgeries to oxygenate the blood while they heal. We've now even gone to the extreme of replacing both lungs in a patient. How sustainable is this? Or do we accept that death happens and people have to take self-responsibility in ensuring our personal safety? How can we emphasize support with family, friends, and government while society carries on? In this endeavor, perhaps we should consider the actions of our nation's leader, Prime Minister Trudeau, whose business savviness has forced Canadians to delay second doses of vaccines against recommendations, redirected vaccines from third world countries to Canada, had Canada ranked 42nd internationally in vaccine success until recently, and his vaccine strategy is to overload provinces with vaccines to make them look so bad and him look oh so good for an election. Now this is a guy who looks like he's willing to sacrifice a lot for his own good. Should we?
The honourable member for Red Deer South.
Thank you, Mr. Speaker. Galileo is the father of the scientific method. Observation and experiment, formulation and testing of hypothesis. Galileo said the earth revolved around the sun. He was attacked for saying so. The science is settled. Follow the evidence. The sun rises in the east and sets in the west. The sun must revolve around the earth. He was disparaged and subjected to the Inquisition, a de facto cancel culture. While there are immutable moral truths, our understanding of the world we live in has and will evolve with time. By asserting that the science is settled, to shut down good faith inquiry can be a form of cancel culture, undermining the scientific method, which by definition tests prevailing orthodoxies. Prevailing orthodoxies may be correct, but there needs to be an openness that they may be only partially right or even wrong. The truth prevails without the need for cancel culture. Sometimes the media forsakes its stewardship as an impartial reporter of fact in favor of half-truth. Too often there is selective fact emphasis, which can distort truth, or worse, support narratives of fear or contention. Large groups should not be condemned and labeled by the actions of a few. It is wrong to seek to destroy a person's name and character by interpreting and sometimes twisting a person's words in worst possible ways. Let us be loyal to the truth and to speak the truth in love. We will be happier and better.
Honourable members, the time is 1:50 and it is oral question period. And the Honourable member for Edmonton Glenora has the first question.
Mr. Speaker, yesterday Alberta reported a record number, 1,332 variant cases of COVID-19. Many Albertans believe this Premier waited too long to act and was distracted by the COVID-denying cohort within the Conservative caucus. Albertans fear now that their businesses and schools will stay closed longer, their hospitals will be overwhelmed, and that they won't be able to spend time with friends and family this summer. We have the highest per capita case count in Canada. Does the Premier take any responsibility for the role that he played in causing the third wave?
The Honourable the Premier.
Mr. Speaker, that question is ridiculous and very typical of the NDP, seeking always to politicize this pandemic. Mr. Speaker, the third wave is present in most jurisdictions across most colder jurisdictions in the Northern Hemisphere. I don't take responsibility for the third wave in British Columbia under an NDP government any more than the other provinces. Mr. Speaker, this is not a political issue. It is a public health issue, and that is how Alberta has approached it, seeking to take a balanced approach to protect lives and livelihoods, to protect our healthcare system, human lives, and the broader health of our society.
The Honourable member for Edmonton Glenora.
Except Alberta has the highest per capita rate, Premier. Effective today, 68,000 Edmonton public and Catholic students must learn from home. They join another 90,000 from Calgary, Fort McMurray, and Sherwood Park who are already there. We know many parents across the province fear that they will be next, and that their families will be thrown into chaos looking for a plan to prevent things from getting even worse. To the Premier, give Alberta families hope. Will you do anything new to make their schools safer and prevent more closures? We want them open, teachers want them open, families want them open. They need the Premier to act now to make them safer.
Oh, the Premier.
Mr. Speaker, schools are safe. It is time that the NDP stopped the fear-mongering. We have 700,000 students, Mr. Speaker, of whom 1,800 have been identified as having received transmission of the virus in school. That means that 99.75% of Alberta students have not been affected by in-classroom transmission. The NDP's supposed plan would do absolutely nothing to change that fact, Mr. Speaker.
The Honourable member for Edmonton Glenora.
160,000 have been sent home, Premier, and you're doing nothing to make things better for when they go back. The Premier scoffed when asked why workers at the Cargill meat plant will no longer receive the COVID-19 vaccine that they were promised. Dr. Amy Tan has worked with racialized communities throughout the pandemic. She told the CBC she believes these workers, most of which are from racialized communities, are being systemically ignored. To the former federal Minister of Immigration and the current Premier, are you really going to ignore these workers? Their lives may very well depend on you.
The Honourable the Premier.
Well, Mr. Speaker, only the NDP could take a shortage of vaccines, a cancellation of vaccine shipments, and turn it into a question of racial division. Shame on them. Mr. Speaker, they didn't receive the vaccines that they were promised, which is deeply regrettable, because Alberta did not receive the vaccines that Alberta was promised. 65,000 Moderna vaccines, some of which were going to that and other meatpacking plants, were cancelled, did not show up as they were scheduled, Mr. Speaker. And so we cannot deliver vaccines that we do not have.
The Honourable member for Edmonton Gold Bar has the next question.
In late October, the then Minister of Economic Development and Trade met with a foreign coal company and went on record offering to do anything to get their project approved. 6 months later, the coal policy was quietly rescinded. Fast forward to Tuesday, and at public accounts, we heard that the ministry conducted absolutely no economic analysis of the impact of coal development. No assessment of what it meant for other industries. It begs the question, why did the Premier sell out to the coal industry and put their interests above those of every other industry?
The Honourable the Premier.
Well, Mr. Speaker, again, that question is patently ridiculous. Alberta has a 140-year history of coal mining, including on the eastern slopes, including under the previous NDP government. In fact, as I pointed out before, the predecessor to the NDP, the Alberta Labour Party, was founded by the coal mining unions Mr. Speaker, that the NDP government approved of and supported the expansion of coal mines in this province. We are consulting with Albertans to ensure we strike the right balance between environmental protection and responsible resource development.
Member for Edmonton Goldbar.
It seems to me that consulting Albertans should require full information on the economic development and the impact of that. If the government cared about Albertans and the jobs they currently have, the Premier wouldn't have just handed a blank check to the coal industry. In his first year of the government's mandate, the Premier waxed poetically about doubling the tourism industry in 10 years, but at the same time, he was sabotaging the industry's chance for success. At public accounts, officials confirmed that there was no analysis done on the implications of coal development on the 10-year tourism strategy. To the Premier, will your government finally conduct an analysis of the impact of coal development on tourism?
The Honourable Premier.
Well, Mr. Speaker, of course, the 10-year tourism strategy was interrupted by a minor event called a once-in-a-century pandemic. The Minister of Jobs, Economy and Innovation is working with the tourism industry, including through a $20 million increase in funding for Tourism Alberta to support their post-pandemic relaunch. With respect to coal mining, Mr. Speaker, I want the NDP to meet with all of the union members, the thousands of union members who work responsibly in Alberta's coal industry, and tell them that the NDP wants to put every single one of them out of work.
Here, here. The Honourable Member for Edmonton Goldbar.
It's weird that the pandemic didn't cause a pause to the coal mining industry in this province. It's not just the tourism industry, though, that's under threat from this government's backwards coal policy. It's also ranchers and agriculture. As his Premier quietly worked to dismantle the coal policy, the Ministry of Jobs, Economy and Innovation failed the people of Alberta. Despite being the central clearinghouse in government to bring in a wide range of perspectives on economic development, the ministry told public accounts that they did zero broader economic analysis and provided no advice about what the coal policy rescinding will mean. Will the Premier commit to releasing the results of the online survey immediately?
Honourable the Premier.
Mr. Speaker, the member opposite just said, quotes, "It's weird that the coal industry wasn't shut down during the pandemic." It would only be weird for a New Democrat because they have wanted to shut down the entire economy hard from day one. And we just heard it from him. They wanted to shut down the mining industry. And guess what? Mining, including the energy sector, Mr. Speaker, is a quarter of the province's economy, and they think it's weird we didn't shut them down. Mr. Speaker, thank goodness they were not in office during this time of great crisis.
Here, here, here. The member for Edmonton Manning is next.
Well, thank you, Mr. Speaker. Today, the leaders of the Alberta NDP joined fellow New Democrats in Saskatchewan and Manitoba to call on the Conservative governments in all three provinces to go back to the table with Ottawa and invest in what is necessary to maximize funding for Alberta's agriculture industry. This is a direct response to the call of agricultural industry leaders in all three provinces. The federal agri-stability proposal goes till 2023, and for every dollar the province invests, they get $1.50 back. This is a modest and reasonable request of the government, so will the UCP step up and listen to farmers and ranchers?
The Honourable the Minister of Finance and the President of Treasury Board.
Well, thank you, Mr. Speaker. I can say yes, we will listen to farmers and ranchers. The Minister of Agriculture does that every day. He's on the every day on the job listening to Alberta's great agriculture producers. And Mr. Speaker, there has been a recent change. We have removed the reference margin limit cap in the agri-stability program. Mr. Speaker, this will in fact improve the program while the minister works with industry groups to create an even better risk management program.
Here, here.
The Honourable Member for Edmonton Manning.
Well, thank you, Mr. Speaker. As the minister is also aware, the compensation rate did not change in this negotiation. That is what I'm talking about. 11 Alberta Agricultural Associations and organizations asked the province to sign the proposal. These voices included Alberta Barley, beef producers, canola, pork, pulse growers, sugar beet growers, potato growers, and wheat commission, and the Alberta Federation of Agriculture. They've all clearly articulated their position, and it's known to this government. To the Premier, farmers and producers have spoken loudly. Why isn't this government listening? Why don't they sign on to the compensation rate changes?
The Honourable the Minister of Finance, President of Treasury Board.
Mr. Speaker, this government is listening intently to farmers and ranchers across the province. And while the minister works with industry groups on a renewed approach to business risk management, Mr. Speaker, let me read into the record some of the accomplishments. We've repealed the disastrous Bill 6 that the members opposite punished Alberta's farmers and ranchers with, Mr. Speaker. We've passed Bill 27, which is to protect farmers and ranchers from trespassing protesters. Mr. Speaker, we've created results-driven agriculture research. We've provided a 20% discount to agri-insurance premiums and much, much more.
Hear, hear.
The honourable member.
Well, thank you, Mr. Speaker, and thanks to the Finance Minister for giving farmers back their own money. Again, we're talking about compensation rate. The effects of COVID-19 on the supply chain impacts agriculture significantly. And we have a UCP government that routinely leaves federal money on the table. What this government is actually doing is trying to save money on the back of Alberta farmers and ranchers. To the Premier, will he admit he's putting political ideology over supporting Alberta agricultural sector? And will he explain how we're supposed to support the agricultural economic future without compensation?
The Honourable the Minister of Finance.
Mr. Speaker, let me express to the honourable member what we really are doing for Alberta agriculture producers. Mr. Speaker, we recognize that that industry competes globally. We have a world-class industry in this province, and we're positioning that industry to be most competitive, Mr. Speaker. In fact, let me say this. The Alberta agriculture industry is one of the shining lights in our effort to grow this economy, Mr. Speaker. They are one of the shining lights in the current economic recovery that's taking shape today.
The Honourable Official Opposition House Leader.
61% of Alberta's COVID-19 fatalities originated in long-term care. Residents and staff have died. We've also seen workers die as a result of a massive COVID-19 outbreak at the Cargill and JBS meatpacking plants. Families are grieving. They've lost loved ones, and our hearts go out to all of them. And people want answers. They want to know how these outbreaks happened. Was enough done to keep their workplaces safe? They want to know if there was negligence, that those operators who were negligent will be held accountable. Will the Premier commit that the government will not introduce legislation that cuts off justice for these families?
The Honourable the Minister of Health.
Well, as the member knows, nothing can be spoken about until later on this afternoon when the member for Calgary-Fish Creek is going to be tabling his legislation, Mr. Speaker. So I look forward to the opportunity to seeing the legislation that will be tabled by that honourable member, and we will then be able to speak on it then.
The Honourable Official Opposition House Leader.
The workers of Cargill endured so much through this pandemic. They were assured by this government that their workplace was safe when the agricultural minister had been briefed that workplace transmission was happening and chose not to disclose that to them. Thousands of workers were infected, and tragically 3 lives have been lost. These workers and the families of those who lost loved ones are looking for answers. A class action lawsuit has already been filed against Cargill on behalf of these workers. Will the Premier commit that he will not introduce legislation that would void that class action lawsuit? These families have lost Alberta workers. They're seeking justice.
The Honourable the Premier.
Yes, Mr. Speaker.
The Honourable Official Opposition House Leader.
These families deserve answers. They deserve justice, and they deserve a government that supports them. This government has a chance to stand with these families, workers, residents, and staff to show that they have their backs during this pandemic. And I'm going to keep it very simple and ignore the heckling from the government about dead workers. Will the Premier or any member of the Cabinet confirm that they will not stand in the way of justice for grieving families when this pandemic is over? It's a simple question. Give these families a clear answer.
Order is noted at 2:03. The Honourable the Premier.
I just did. The answer was yes, Mr. Speaker.
The Honourable Member for Fort McMurray, Lac-La-Biche.
Thank you. After a long, dark road this past year with the COVID-19 pandemic, vaccinations are now the light at the end of our tunnel, and they are the key to our province's recovery. Yesterday, Alberta's government took swift action to remove potential barriers so that eligible Albertans are able to get vaccinated when their turn comes. To the Minister, is any eligible employee able to take advantage of this new COVID-19 vaccination leave when they qualify to be vaccinated, and is their leave job protected?
The Honourable the Minister of Finance and President of Treasury Board.
Well, thank you, Mr. Speaker, and thank you to the member for the question. Bill 71 was introduced and passed yesterday because our government wants to reduce the barriers for any Albertan being able to get their vaccination. No one should have to choose between putting food on the table for their families and receiving a COVID-19 vaccination. All eligible employees, whether full-time or part-time, regardless of the length of their employment, are able to access this paid leave.
The honourable member for Fort McMurray-Lac-La-Biche.
Thank you, Minister. Given that Albertans across the province are anxiously waiting for their opportunity to be vaccinated and to help protect themselves and others from COVID-19, and given that many Alberta businesses are wanting eased public health restrictions so that they can get back to work, and given that we continue to encourage employees and employers to work together as they now schedule this new COVID-19 vaccination leave, to the Minister, can you please highlight the benefits to employers of having a vaccinated workforce?
The Honourable the Minister of Finance.
Well, thank you, Mr. Speaker. All Albertans want to put COVID-19 behind them, and that's why our government has taken action. Having a vaccinated workforce will mean lower absenteeism for employees and make a more stable workforce for our Alberta businesses. We thank each and every Albertan that takes a vaccine, and we also thank each and every employer as they work with their employees to accommodate vaccinations.
Honourable Member.
Thank you, Minister. Given that our COVID-19 vaccination program is ramping up all across our province, and given that with Bill 71, Alberta's government has taken swift measures to reduce the barriers to any eligible Albertan receiving the COVID-19 vaccine, if they so choose, and given that vaccinations are crucial, not only for Alberta's workforce, but for families as well, to the Minister, can you please stress the importance of what having a vaccinated population will mean for Albertans all across this province?
The Honourable Minister.
Well, thank you, Mr. Speaker, and again to the member for the question. COVID-19's had a significant impact on the lives and livelihoods of Albertans. The faster Albertans are vaccinated, the faster our economy will be able to open up. Our government is focused on getting Albertans back to work, and we thank everyone for the steps that they're taking each day to help accomplish that goal together.
Member for Calgary Mountain View has a question.
Thank you, Mr. Speaker. Yesterday, we found out that Sangling Energy will be ceasing operations at the end of the month. This comes after the AAR suspended licenses of the company last month as a result of maintenance and cleanup orders. Basically, the company is walking away from any responsibility, and it could be Albertans who are on the hook to clean it up. Sangling holds licenses for 2,266 wells, 227 facilities, and 2,170 pipelines. To the Minister, how much are taxpayers going to be on the hook for?
The Honourable the Deputy Government House Leader.
Well, thank you, Mr. Speaker, and I actually got to say I'm kind of surprised. That was a good question, and I thank the Honourable Member for the good question. Mr. Speaker, but as the Honourable Member also pointed out, this happened yesterday. And while the question is good, I acknowledge that, and I don't think it's fair to actually ask that the answer be available today. I think it's fair to ask the question, and in due course, the answer will be available. It's just not available today, Mr. Speaker.
The Honourable Member for Calgary Mountain View.
Thank you, Mr. Speaker. Given that we already have a growing orphan well problem in this province, and that Sangling repeatedly refused to follow the rules or follow compliance orders, essentially flouting the rules, and given that companies like Sangling seem to think that they can walk away from their responsibilities, Minister, Sangling is just the tip of the iceberg. What are we doing to resolve this problem?
The Honourable the Deputy Government House Leader.
Well, thank you, Mr. Speaker, and as I expect the Honourable Member knows, because there's been considerable talk about this in the House. We are government's working together with the federal government. There's we have an orphan well program that's been in place for a long time. We're working together with the federal government. Our environment minister and our premier worked with them to get funding to help clean up orphan wells. And as the Honourable Member said, this particular company may have been doing this for a long time, which would include the 4 years that member was a minister and did nothing about this issue.
The Honourable Member for Calgary Mountain View.
Given that there is also a growing crisis of unpaid property taxes by some oil and gas companies, with over $245 million owing to municipalities, and given that the government has done nothing to support these municipalities, leaving Alberta taxpayers on the hook, And given that the Minister of Municipal Affairs said at AUMA last week there's not much the government can do to recoup the amounts owed to the government, is anyone willing to stand up for Albertans and take real action to combat this growing crisis?
The Honourable Premier.
Speaker, the Minister of Transport has answered that question, but since that member is rising, I'd like to raise something that I find deeply disturbing. Yesterday, she posted on Twitter a comment referring to the Honourable Minister of Jobs, Economy and Innovation as, quotes, another angry, mediocre white man, unquotes.
Wow.
Mr. Speaker, does the member believe that it is appropriate to make pejorative remarks about fellow honourable members based on their race?
Honourable Member for Edmonton Whitemud.
Mr. Speaker, this morning I wrote to the Minister of Children's Services after hearing concerns from within her department that she plans to go forward with cuts to supports for vulnerable young people previously in government care. I told the Minister I've heard she's planning to press ahead with reducing the eligibility age for the Supports and Financial Assistance Program, or SAFA program, from 24 to 22, the very cut she previously intended to make that is now the subject of a constitutional challenge. To the Minister, is the government moving forward with cuts to the eligibility age for SAFA, yes or no?
The Honourable the Minister of Service Alberta has risen.
Mr. Speaker, the Minister of Children's Services has worked hard to ensure that youth in care and those young adults transitioning out of care have the support they need during this time. We understand these times are unprecedented and have created new challenges, especially for those who are most vulnerable. As we remain in the pandemic, all youth aged 22 to 23 will continue to receive SFAA benefits. Caseworkers and recipients will plan over a period of months to ensure they have natural supports in place and are set up to succeed as adults once the pandemic subsides.
The Honourable Member for Edmonton Whitemud.
Well, given that the SAFA program provides critical financial and emotional supports to these vulnerable young people, and given that there's been a disturbing increase in the number of deaths among young adults this year who are part of that program, and given we are still in the middle of a pandemic, and the Minister herself stated publicly that she would make sure no young adult is left without supports at a difficult time, can the Minister definitively promise in this Assembly that the government is not currently working on plans now or in the immediate future to lower the eligibility age for this program?
The Honourable the Minister of Service Alberta.
Mr. Speaker, as I've said, the Minister of Children's Services is working hard to ensure that youth in care and those who are young adults who are transitioning out of care have the supports that they need. And Mr. Speaker, a good example of that is how Alberta is the only jurisdiction in Canada to offer a bursary program that includes social, emotional, and funding support specifically for young adults formerly in care while they pursue post-secondary studies. And the supports we provide after former youth in care turn 18 are among the most generous in the country. Many provinces are moving towards tailoring supports specific to youth, not based on their ages, and we're doing the same. Our frontline workers will continue to work closely with young adults to ensure they have the right financial support.
The Honourable Member for Edmonton Whitemud.
Given that there is no assurance there for these young people requiring these supports, and given that during debate of the 2021 budget, the Minister indicated funding for a full year of the SAFA program was included and is available, and given this Minister lost the trust of so many advocates and support workers that work with these vulnerable young people when she attempted to push through these cruel cuts to funding without consultation or any consideration of the real impact it would have on their lives, to the Minister, will she actually rule out permanently any cuts to the SAFA program, and will she apologize to vulnerable Albertans and the people who support them for the damage that these cuts have created?
The Honourable Minister of Service Alberta.
Mr. Speaker, I guess I just need to say it a third time that the Minister of Children's Services continues to work hard to ensure that youth in care and those young adults transitioning out of care have the supports that they need. And our frontline workers will continue to work closely with these young adults to ensure that they have the right financial, emotional, and practical supports, including stable connections to their community and to other important individuals in their lives that will endure well beyond government programs. Programs like Advancing Futures, for example, it's a one-of-a-kind program which pays for all post-secondary costs, including a living allowance. And mentoring programs to help build natural lifelong connections can continue well into adulthood.
The Honourable Member for Lesser Slave Lake has a question.
Thank you, Mr. Speaker. One of the most important catalysts for sustainable and tangible economic growth is the cultivation of robust housing availability and the consistency such availability provides to residents' quality of life. To the Minister for Seniors and Housing, what measures are being taken or explored for improving the availability of housing for all communities across Lesser Slave Lake?
The Honourable the Minister of Seniors and Housing.
Thank you, Mr. Speakers, and to the member for the questions. Alberta government is committed to affordable housing for those most in need, which is including individuals, families living in the community outside of our urban center and in the town of Silver Lake. Mr. Speakers, our government remains committed to the P3 mixed income 40 units project by investing $4.2 million as a capital grant, helping to meet the needs of Albertans in this community.
The honourable member for Lesser Slave Lake.
Mr. Speaker, given that there is a need for new housing units of all tenures, and given that regions like Lesser Slave Lake are not immune to rising housing costs, and given that the goal of home ownership is critical to building strong personal financial foundations, as well as contributing to our broader economy, can the Minister please inform the House of her plans to increase the supply of all types of housing in rural regions across Lesser Slave Lake?
The Honourable Minister of Seniors.
Thank you, Mr. Speakers, and the member for the questions. Our government is committed to transforming the affordable housing system in northern Alberta and the entire province. This transformation, so we result in a more flexible, fair, and inclusive housing, more options that meet the Alberta's need for now and in the future. Mr. Speakers, our government is redefines our role, tapping into community expert, expanding partnership, rewarding innovations, and simplify the housing system as outlined on our report.
The honourable member for Lesser Slave Lake.
Mr. Speaker, given that the need for affordable housing is growing, and given that planned projects underway for said affordable housing will result in much improved units for those needing housing in the constituency, to the Minister for Seniors and Housing, can she, for the sake of information for this Assembly and my constituents, provide a timeline for when the affordable housing project in Slave Lake, particularly the one she just spoke about earlier, will fully come to fruition?
The Honourable Minister of Seniors and Housing.
Thank you, Mr. Speakers, and thank you to the member for the questions. Mr. Speakers, the express of interest for the affordable housing projects in the Silver Lake that was closed on April the 8th. We are currently reviewing some of the results and the submissions. And Mr. Speakers, I would like to make sure and that the Assembly that we are working closely with the town of the Silver Lake and the housing management body for this affordable housing project.
The honourable member for Calgary-McCall is next.
Thank you, Mr. Speaker. To get through this pandemic, we all need to work together, get vaccinated, and follow the rules set out by public health designed to protect the health of all Albertans. Throughout this pandemic, 576 tickets under the public health have been issued. However, over 40% of those tickets have been withdrawn. This sends a concerning message to those Albertans who are following the rules. Can the Minister of Justice explain why so many tickets issued under his watch are being withdrawn?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. Mr. Speaker, let me thank the Alberta Health Services and the law enforcement and staff at the Chief Crown Prosecution Office for working together to ensure that we investigate and implement the public health orders that has been put in place to ensure we protect Albertans. Mr. Speaker, I am thankful for those public servants who are working day and night to ensure compliance with the public health orders. And I am confident that they will continue to do that so that we can put this pandemic behind us.
The honourable member for Calgary-McCall.
Given that it does our public health and law enforcement professionals a disservice if faith in public health order is undermined, and given that this government has already done damage to the trust that many Albertans have in public health order with this government's refusal to stand up to the 17 members of the caucus who are seeking to undermine public health orders in place, given this and the critical nature of public health order, will the Minister of Justice commit to a review of the legislation and orders to get to the bottom why so many of these tickets are being thrown out?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. Mr. Speaker, as Justice Minister, we expanded the role of the sheriffs and community peace officers to be able to enforce the public health orders across our province. And the member from Calgary-McCall would know that the elected leaders does not direct enforcement, does not direct prosecution, and these are matters that are dealt with independently. And I expect the member from Calgary-McCall to not inject politics or partisanship with a matter that ought to be dealt with independently by those to whom we have charged with that responsibility.
The honourable member for Calgary-McCall.
Given that during this global pandemic, and especially during the deadly third wave, we cannot have public health orders that no one believes that will be enforced, and given that the Alberta Association of Chiefs of Police have urged the province to consider escalating consequences for those who continue to break public health measures. That's a request coming from associations of chiefs of police. Is the minister listening to this call, and will he consider escalating consequences against those who recklessly endanger public health?
The Honourable Minister of Justice.
Mr. Speaker, it is disappointing but not surprising that a member from Calgary-McCall will seek to undermine the hard work of men and women of law enforcement. Mr. Speaker, let me thank the staff at our Alberta Health Services, again, those who work within our justice system for their diligence in making sure that all Albertans comply with the public health measures. I am confident that enforcements are being carried out across our province, but what we would not do is to allow the political class to direct enforcement.
Order, order. The honourable member for Edmonton City Centre has the call.
Thank you, Mr. Speaker. The data is clear. Racialized communities have been disproportionately impacted by COVID-19. They're more likely to be employed as frontline essential service workers and in higher risk settings like meat packing plants, or much less likely to have access to supports like paid sick leave. Unfortunately, they also face more challenges to getting vaccinated, including lack of transportation, language and cultural barriers, challenges accessing information or booking appointments online. To the Minister of Health, what, if any, specific steps are being taken or planned to promote and provide vaccinations to racialized communities?
Honourable members, I did fail to note the point of order at 2:20, but I have made myself a note. The Honourable Minister of Health to answer.
Thank you, Mr. Speaker, and thank you for the question. It's a fantastic and thoughtful question. AHS has purposely made steps to make sure that they have vaccination clinics that are close to those communities, and so that, and for example, close to public transportation, so that folks who might not have the ability to drive themselves can use public transportation to be able to make their way to a vaccination clinic located. For example, in Calgary, the Genesis Centre, AHS purposely made a vaccination clinic at the Genesis Centre with that in mind, as well as making sure that we're continuing to expand the rollout to our pharmacies.
The Honourable Member for Edmonton City Centre.
Thank you, Mr. Speaker. Now, given that in December, the government recognized the importance of working with cultural community leaders through COVID care teams, and given that provinces like Ontario and BC are using initiatives like mobile vaccination teams and pop-up clinics in high-risk congregate settings, residential buildings, and faith-based locations to promote and provide vaccinations in hotspot neighborhoods and impacted communities, to the Minister of Health, will the government consider working with local cultural leaders and health professionals to make vaccinations more accessible to their communities? Could we see mobile vaccination teams or pop-up clinics in Alberta to help get them vaccinated?
The Honourable Minister of Health.
Well, the simple answer is yes, Mr. Speaker, and we are. And I'd also just like to point out as well that our COVID care teams that are going throughout our communities are also reaching out to those racialized communities and making sure that they understand the safety and the efficacy of vaccines, as well as providing knowledge about the other supports that government is being able to provide to those folks throughout the pandemic. But the answer, quite simply, to his question is yes, and we already are.
Member.
Thank you, Mr. Speaker. Now, given that I recently received a proposal from Al Taqwa Mosque in my constituency to partner with a local pharmacist to promote and provide vaccinations to over 8,000 members of local East African communities, and given that they estimate that in those communities they serve, vaccination uptake by eligible individuals is currently less than 10%, and given that I've submitted their proposal to host a vaccination site at the mosque to both AHS and the Minister's office, will the Minister commit to following up with his staff and AHS to see if we could make this collaboration and perhaps others like it happen?
The Honourable Minister of Health.
The answer again is yes, and those are the types of opportunities that we have been seeking since December when we started to plan the vaccine rollout, Mr. Speaker, so that we can have not just AHS, but also those innovative community partners who want to work with AHS or for example, with the pharmacies, working with the ministry to be able to provide greater capacity for us. And we know that vaccine uptake is going to be directly correlating to the amount of opportunities we have in the community to be able to explain the safety and the efficacy of the vaccines to all Albertans, whether it's our family physicians or pharmacists, so that people can have a greater uptake.
The honourable member for Red Deer South has a question to ask.
Thank you, Mr. Speaker. The Supreme Court conferred a dangerous power on Ottawa, ripe for abuse. Under the guise of a carbon tax, can disproportionately harm Albertans. Let's be honest. Carbon taxes are as much political as they are environmental. If Quebec was an oil and gas jurisdiction, Ottawa would never impose these forms of carbon taxes. To the minister, how does Ottawa's carbon tax disproportionately harm Alberta businesses and families?
The Honourable the Premier.
Well, Mr. Speaker, I disagree with the member in one respect at least, which is that carbon taxes are not as political as they are environmental. They're far more political than they are environmental. There's been no evidence of reductions of emissions in Canada as a result of punishing people for filling up their gas tanks and heating their homes. Mr. Speaker, and I would point out that Quebec, for example, is permitted by the Government of Canada to operate a cap-and-trade scheme, the effective price of which is $20 a tonne, versus the $40 a tonne notional price in Alberta, which is going to $170 a tonne, which is why we fought this all the way to the Supreme Court and will choose an option that imposes the lowest cost on Albertans.
The honourable member for Red Deer South.
Given the U.S., our biggest trading partner has no federal carbon tax, and given Ottawa's carbon tax is $40 per tonne, and given the Trudeau Liberals say they will increase the carbon tax by over 400% to $170 per tonne, to the minister, what will this carbon tax do to Alberta's ability to compete for capital investment in our natural resources?
The Honourable the Minister of Finance, President of Treasury Board has risen.
Well, thank you, Mr. Speaker, and again to the member for the question. The member's correct. The carbon tax imposed on Alberta businesses and on Albertans will actually undermine our competitiveness as our key sectors do compete on the global stage. Mr. Speaker, we are doing everything in our means to combat this tax. Of course, that's why we took our case all the way to the Supreme Court. And Mr. Speaker, in the meantime, we're doing everything else we can to create the most competitive business environment possible, Mr. Speaker, to ensure that Alberta businesses can compete within Canada and globally.
The honourable member.
Given Ottawa's carbon tax punishes Alberta businesses and makes them less competitive, and given Alberta families and individuals' livelihoods will suffer from skyrocketing carbon taxes, to the minister, what will the government do to address the destruction of this carbon tax and protect the competitiveness of our natural resource businesses?
The Honourable Minister of Finance.
Well, thank you, Mr. Speaker, and again to the member for the question. As I've stated many times in the past, in fact, just in my previous statement, our goal is to create the most competitive business environment possible, Mr. Speaker. I call it a special economic zone and refer to that as Alberta, Mr. Speaker. Adhering to the fiscal anchors we've outlined in Budget 2021 will allow us to maintain the overall lowest tax burden in the country. By aligning our spending with that of comparator provinces and keeping our net debt to GDP ratio below 30%, Albertans can be assured that we are doing everything in our power to offset this federal tax burden.
The honourable member for Edmonton Riverview.
In the federal government's budget, there is even more funding allocated to affordable housing. Clearly, there is federal money on the table for provinces to use. Tragically, Alberta does not have a government willing to use it. The City of Edmonton has made a repeated request for $6 million to help the most vulnerable have a safe place to call home. To the Minister of Seniors and Housing, will she commit to this funding? And if not, why not?
The Honourable the Minister of Seniors and Housing.
Thank you, Mr. Speakers. And we are continuously working very closely with the three-level government, federal level, and municipality. And currently, for the capital grant, we are investing $238 million for 3 years and continue to build affordable housing. We have completed 1,200 units in the last 2 years, and we continue to build 1,800 units for the entire year. And then, of course, we are going to create 1,700 jobs, which is the under recovery plan. Thank you.
The honourable member for Edmonton Riverview.
The federal budget has provided multiple options to assist provinces with affordable housing and has previously offered millions for the Canada Housing Benefit. And given that mayors and councils in Alberta have made it unequivocally clear they want to work with both the federal and provincial governments to increase housing, to the Minister of Seniors and Housing, when will she provide matching dollars for the federal rental supplement program that almost all other provinces have already signed on to? Why is she denying Albertans this support during a pandemic when they need it most?
The Minister of Seniors and Housing.
Thank you, Mr. Speaker. I will welcome the private members to read our strategy plans. We already matching our federal government dollars by the $561 million. We are maximum and use every single dollar that we can match and continue to build affordable housing for the Albertan who most in need. Thank you.
The honourable member.
Given that to eliminate poverty, all levels of government need to work together, the federal and municipal want to act, but the UCP continues to sit on their hands. To the Minister of Seniors and Housing, how many people need to sleep cold at night? How many people need to contract COVID because they do not have an adequate place to call home? How many need to lose their homes and be pushed onto the streets because the government is refusing to act? Does the UCP's mantra of protecting lives and livelihoods stop when it comes to Albertans on low income?
The Honourable the Minister of Seniors and Housing.
Thank you, Mr. Speaker. Let me repeat it again, and let me make it clear. We are continue building affordable housing. We have completed at a 1,200 affordable housing unit, which is way more than the 4 years the previous government did in the 4 years. We are continuing to build 1,800 affordable housing and create 1,700 jobs and continue to working with the federal government. In fact, the Monday, I will have a call with the Minister of Canada and Housing and looking for partnership and getting more funding from the federal government.
The honourable member for Edmonton Gold Bar has a question.
The Premier says that representing your constituents is the primary role of an MLA. However, this is a lesson that many on the other side seem to have either forgotten or chosen to ignore. The members for Sherwood Park and the Minister of Service Alberta are still defending the government's curriculum, which is being rejected by Albertans, from parents to teachers to school boards. And most notably, the residents of Sherwood Park have resoundingly given the curriculum a failing grade. Why is the Minister of Service Alberta refusing to listen to his own constituents? Does he need to do some learning himself on what it means to be an MLA?
The Honourable the Minister of Service Alberta.
Mr. Speaker, the notion that I or my colleague from Sherwood Park are not listening to our constituents is laughable. The member is alleging that we're not listening to our constituents. We do. Now, Mr. Speaker, you and I both know that you can't make everybody happy all the time, and not everyone in Alberta agrees on everything. And that's fine, that's normal, that's healthy, that's democracy. Now, we are supporting the Minister of Education as she has been working on the K-6 curriculum, and we believe that as we move towards piloting this curriculum, that's the best way for us to get feedback from all Albertans, including teachers, parents, and the folks who've been writing to my office.
Member for Edmonton Gold Bar.
Thank you. Given that Danielle Till, a parent of 3 in Sherwood Park, said, quote, "It's frustrating to write to your MLA with specific concerns and then get a stock copy-paste response. It makes it clear that your letter wasn't read or considered," end quote. Given that the Minister for Service Alberta stated that the consultation on this curriculum was open and transparent, but given that he would be hard-pressed to find either a school board or someone not on the UCP payroll to endorse this curriculum, who is the minister talking to that supports this curriculum? Because it's clearly not his constituents.
The Honourable Minister of Service Alberta.
Mr. Speaker, look, as I've said, the Minister of Education is working hard on this curriculum, and now we are at the natural stage where it's time to pilot it. It's time to trial it and show what it can do in practice. And this is the best opportunity for all Albertans, including parents and teachers, administrators, everyone in Alberta to see the curriculum in action. Mr. Speaker, it's been over 30 years without an update for a lot of this curriculum. It's long overdue, and so we need to trial it. We need to show what it can do, and then if there are changes that need to be made, we will have plenty of opportunity to take that feedback. So I invite all of my constituents to continue to be involved in the consultation.
The honourable member for Edmonton Gold Bar.
Given that some of the words used by the Minister of Service Alberta's constituents to describe this curriculum include discriminatory, divisive, exclusionary, age inappropriate, and quote, not a curriculum anyone wants to teach, end quote, and given that before anyone on the UCP describes these voices as belonging to special interests, I would remind the Minister that these are his constituents and, importantly, Albertans that he's failing to listen to. Will the Minister listen to the people who sent him here and use his position in Cabinet to have this disaster of a curriculum pulled? Or does he value his seat around the Cabinet table more than representing his constituents?
Point of order is noted at 2:35. The Honourable Minister of Service Alberta.
Mr. Speaker, as I've said before, I listen to my constituents. And the best way for us to listen to all of our constituents with the subject of the curriculum is to continue the process. The Minister of Education has a process. We're sticking to the process, Mr. Speaker, and the next stage of that process now is to trial that curriculum and give all Albertans, including parents and teachers, the opportunity to weigh in and say, now that we've seen it in practice, here's what we like, here's what we don't like. So I invite all of my constituents to participate in that process, to continue with the online consultation, and to watch as we trial this curriculum to see how well it can work in practice.
The Honourable Member for Livingston-McLeod is next.
Thank you, Mr. Speaker. We all know, especially during this difficult time, that understanding how money works is extremely important and necessary. From savings to investing to managing credit and debt, we need these practical skills to succeed. Yesterday, the Minister of Education and the Minister of Finance announced a call for grant proposals for organizations to teach financial literacy to Alberta students. To the Minister of Education, can you tell us the amount available in these grants and how this will impact Alberta students?
The Honourable Minister of Education.
Thank you, Mr. Speaker. I was so pleased to announce yesterday that Alberta's government is releasing a call for grant proposals for $1 million for an organization or groups of organizations to work with schools across Alberta to deliver financial literacy training to junior and senior high students starting this fall. As part of this grant, students will study important concepts such as costs, interest, debt, investing, insurance, and how the economy affects their lives. These are very important lessons that can be taught and learned from a very young age. We owe it to our students to give them a comprehensive understanding of real-world problems and how to solve them.
The Honourable Member for Livingston-McLeod.
Thank you, Mr. Speaker, and thank you to the Minister for her answer. Given that I was excited to see that Alberta's new draft K-6 curriculum will teach students financial literacy starting as early as kindergarten, and given that by learning financial literacy at a younger age, students will have a better understanding of how to manage their money once they get older, can the Minister please explain why this call for grant proposals is necessary, given that the curriculum is being updated and will include this content?
The Honourable the Minister of Education.
Thank you, Mr. Speaker, and thank you to the member for the question. Including financial literacy in the new draft curriculum was an important promise that we made to Albertans, and I'm happy to say that this is a promise we are keeping. As the member mentioned, Mr. Speaker, in the new draft K-6 curriculum, financial literacy will be taught in every single grade, starting in kindergarten. As we draft the grades 7 to 12 curriculum, financial literacy will continue to be embedded. This call for grant proposals is designed for students in older grades, and the program will be implemented for the next school year, the 21-22 school year. Financial literacy is too important to wait. Our students need these skills and knowledge.
The Honourable Member for Livingston-McLeod.
Thank you, Mr. Speaker. Given that this call for grant proposals builds on other successful current financial literacy programs, including those offered by Enriched Academy and Junior Achievement in the 2020-2021 school year, and given that many Albertans may not know about these programs and the benefits that they bring to the students, can the Minister please explain what the results of these programs were and how many students were able to benefit from them?
The Honourable the Minister of Education.
Thank you, Mr. Speaker. Last summer, we announced that we would begin enhancing financial literacy in classrooms through grant partnerships with Enriched Academy and Junior Achievement. These organizations have been working with 39,000 students in grades 4 to 12 in urban, rural, and Indigenous communities across Alberta. These programs were extremely well received by students and teachers. And I would like to read a quote from Ellen, a student participant in the Junior Achievement Program, and I quote, "I've also learned all about making decisions that financially benefit a business or an individual. Break-even points, budgeting, investing, financial management, and so many more financial skills. This program has made a change in my life for the better."
The honourable member for Spruce Grove, Stony Plain.
Thank you, Mr. Speaker. The Stollery Children's Hospital in Edmonton is a world-class facility that provides care to the most vulnerable, our province's children. It's impossible to imagine the anguish felt by families whose children are in intensive care. And this year, thousands of Albertans have been unable to visit sick and dying members in the hospital because of a rigorous COVID-19 protocol. Can the Minister of Infrastructure please tell this House about the good news announced yesterday for the Stollery and how it will ease the struggles of families facing the burden of a sick child?
The Honourable Minister of Transportation and Municipal Affairs.
Thank you, Mr. Speaker, and to the member for the question. Indeed, yesterday's announcement is excellent news for those Albertans facing the most awful circumstances. With these new renovations at the Stollery NICU, each bed is equipped with fridges for breast milk storage, recliners and sleeping sofas for parents, as well as NIC View cameras, so loved ones outside the hospital can check on their baby virtually any time. There is also sleep rooms and a laundry room for families, as well as a family lounge space. I extend my deepest thanks to the Stollery Children's Hospital Foundation and all the medical staff and families who advocated for this important project.
The honourable member for Spruce Grove, Stony Plain.
Thank you, Mr. Speaker, and thank you to the Minister for his answer. Given that the COVID-19 pandemic forced construction to be halted on the Stollery NICU in order to protect ongoing patient care at the facility, and given that the Stollery NICU was the last phase of a three-phase project, and given that patients were being moved yesterday into the newly renovated unit, can the Minister of Infrastructure please tell the Assembly about any delays faced by this project?
Will the Minister of Transportation and Municipal Affairs.
I'm not sure what he said. Mr. Speaker, the honourable, I'm not sure what you said, sorry, Mr. Speaker, but the honourable member, however, is right. We did have to halt construction in the early phases of the pandemic in order to ensure the hospital could continue operating safely. Projects in health facilities that are delivering patient care are always challenging and complex. The Stollery is no exception. I'm pleased to report that this project came in significantly under budget, and after funding was committed several years ago, it is now complete. As much as we hope that no Albertan has to use the facility, we know that many will, and a few extra comforts they deal with during these trying times will be helpful.
Member.
Thank you, Mr. Speaker. Given the challenges that families whose children are in pediatric intensive care are facing, and given the very personal grief and emotion felt by family members at these moments, and given that between 450 to 500 babies each and every single year are cared for at the Stollery Neonatal Intensive Care Unit, can the Minister of Infrastructure tell this House more about the private rooms in this new facility?
Honourable Minister of Transportation and Municipal Affairs.
Thank you, Mr. Speaker. Mr. Speaker, the redevelopment includes 18 beds in single or double patient rooms, offering more privacy and space for patients and family members who stay overnight as their newborns undergo and recover from surgery. The Stollery Children's Hospital Foundation is also providing an additional $1.2 million to fund comfort items for families using the NICU. Mr. Speaker, families were involved at every step of the planning and design of the new unit, helping to build an intensive care space that will improve the journey of health care for patients and families. It's a wonderful project. I want to thank all the doctors, nurses, and staff, as well as the families that contributed to this cause.
Honourable members, this concludes the time allotted for oral question period. In 30 seconds or less, we will return to the remainder of the daily routine.
Special committees.
The honourable member for Airdrie Cochrane.
Thank you, Mr. Speaker. As Deputy Chair on the Standing Committee of Public Accounts, I wish to table on behalf of the committee the appropriate number of copies of the 2019 annual report of the Standing Committee on Public Accounts. And additionally, I'd like to table the 2020 annual report from the same committee. Just please note that both of these reports will be available shortly on the Legislative Assembly website.
Well, the Deputy Chair of the Standing Committee on Private Bills, Private Member Bills.
Thank you, Mr. Speaker. As Deputy Chair of the Standing Committee on Private Bills, Private Members, Public Bills, I am pleased to table the committee's final report on Bill 215, Seniors Advocate Act, sponsored by the Honourable Member from Edmonton Riverview. The bill was referred to the committee on April 15th, 2021. Mr. Speaker, the report recommends that Bill 215 proceed. I request concurrence of the Assembly in the final report of Bill 215.
Honourable members, the motion for concurrence in the report on 215, Seniors Advocate Act, is debatable pursuant to Standing Order 18.1b. Are there any members who wish to speak to the motion for concurrence? Honourable members, given that members do wish to speak to the motion for concurrence in the report, that debate will take place on the next available Monday under the item of business, motion for concurrence in committee reports on public bills other than government bills. The Deputy Government House Leader I see has risen.
Thank you, Mr. Speaker. I move that pursuant to Standing Order 75, Bill...
allow me to interrupt. After the introduction of bills, I believe when the Honourable Member for Calgary-Fish Creek introduces his bill, perhaps that's what you're looking for.
Presenting petitions, notices of motions, introduction of bills.
The Honourable Member for Calgary-Fish Creek.
Thank you, Mr. Speaker. I'm honored to rise and request leave to introduce Bill 70, the COVID-19 Related Measures Act, which I have a copy of here. This bill addresses emerging challenges and COVID-19 civil liability protection for health services in Alberta, including continuing care. The COVID-19 pandemic has put an unprecedented strain on our entire health system, which continues to deliver quality health services to thousands of Albertans every day. While general provisions for liability protection exist in the Public Health Act, it does not specifically address civil liability protection or the unique context in the event of transmission or potential transmission of COVID-19. The legislation would apply to those who deliver health services to Albertans and who have followed and continue to follow the public health orders and guidelines throughout the pandemic. Those who are grossly negligent can and should be held accountable for their actions. The protection would not extend to those deemed grossly negligent. Therefore, Mr. Speaker, I move first reading of the COVID-19 Related Measures Act. Thank you.
Honourable members, the Honourable Member for Calgary-Fish Creek has moved first reading of Bill 70, COVID-19 Related Measures Act. All those in favour of the motion for first reading, please say aye. Aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered.
Bill 70, COVID-19 Related Measures Act, is now read a first time.
The Honourable Deputy Government House Leader.
Second chance to do this, Mr. Speaker. Mr. Speaker, I move that pursuant to Standing Order 75, that Bill 71, the COVID-19 Related Measures Act, be moved onto the order paper under Government Bills and Order.
Members, Honourable Member, I may have over or misheard you, but I believe that you asked to move Bill 71. The Honourable Member just moved Bill 70. Perhaps you might just clarify for the record.
Mr. Speaker, yes, Mr. Speaker, that's what I said, Bill 70.
Perfect. Certainly not what I heard, but I believe it could have been what you said. Honourable members, Standing Order 75 is a motion of the Assembly. However, it is not debatable. So I will call the question. All those in favour of the motion as proposed by the Honourable Deputy Government House Leader, please say aye. Aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered.
Tabling returns and reports.
The Member for Cardston 6 Sitka.
Thank you again, Mr. Speaker. In accordance with Section 22 of the Auditor General Act, as Chair of the Standing Committee on Legislative Offices, I am pleased to table the appropriate number of copies of the report Alberta Health Services use of publicly funded CT and MRI services. All members will receive an electronic copy of this report.
Are there other tablings? Seeing none, the clerk.
Tablings to the clerk, deferred divisions.
Members, points of order. There were 3 points of order called today, and at 2:03, the honourable member for Cardston-Siksika rose on a point of order.
Thank you, Mr. Speaker. I rise on a point of order under 23J, which reads, uses abusive or insulting language of a nature likely to create disorder. When I called the point of order, the member from Edmonton Mill Woods was speaking in response to an answer given, a very brief answer given by the Honourable Premier. And while that answer was given, I believe members on this side of the House had said, take yes for an answer, which was very clearly and succinctly the Premier's answer. In response to that, the member from Edmonton Mill Woods said, I'm going to keep it very simple and ignore the heckling from the government about dead workers. Mr. Speaker, this is deplorable and disgusting to suggest that members of this side of the chamber would ever heckle or even insinuate or celebrate the tragic death of workers, especially during this terrible time of a pandemic. There is no sympathy from members on that side of the House, and I encourage that member to apologize for those remarks and retract them, and please raise the level of decorum in this chamber. Albertans deserve better.
The Honourable Opposition House Leader.
Mr. Speaker, during this exchange, I was asking about Albertans who have died because of COVID-19. I stated the subject of my question when I made that statement. I did not refer to those specific members, but everybody in this room, every single person, has been here at least 2 years and must know how tactless and cruel, especially to viewers at home, it can sound when they start heckling when we are talking about such a serious subject matter. This was incredibly bad judgment on their part. If the government caucus doesn't want to be accused of heckling during questions about the loss of Albertans' lives during COVID-19, then I suggest they raise the bar and don't heckle during questions about the lives lost during COVID-19. I submit to you, Mr. Speaker, this is not a point of order, and that the government should raise the bar and think about what the question is before they start yelling.
Are there others? I am prepared to rule on the point of order. The irony is not lost on me that the members of the opposition might be concerned with one of the few times that I've heard heckles from the government side. I don't think that there's a point of order here, largely speaking. It's a matter of debate. There's two sides of every issue, and the Honourable Opposition House Leader was passionately describing hers and her concern around it. I do, like I say, the irony is not lost on me. With respect to the comments around heckling and not heckling, but perhaps I'll leave that for another day. This is not a point of order. I consider the matter dealt with and concluded. At 2:20, the official opposition House Leader raised a point of order.
Thank you very much, Mr. Speaker. This point of order is very straightforward. During a question and answer on, again, another serious topic, the Minister of Justice said the member of Calgary-McCall seeks to undermine, and he continued on, but it was a very direct statement accusing a member of motives that he did not have. In asking questions, the official opposition does not seek to undermine the justice system, does not seek to undermine public health orders. When we're asking very serious questions, I believe this direct statement falls under 23HI and J and would be a point of order, Mr. Speaker.
Well, Deputy Government House Leader.
Well, thank you, Mr. Speaker. And as I've heard you say in this House many times, that context is important. And one of the context here, it was two lawyers, one on each side, making this argument. And while I never went to law school, I'm pretty sure that both those lawyers know that the government can't direct police and can't direct the justice system. So actually, when our Honourable Justice Minister said that, he was actually saying something the other member ought to know he remembered anything about law school. So this is a matter of debate, Mr. Speaker, and I think the Justice Minister is rightly pointing out that the member from the other side was ignoring what he ought to have learned in law school, and I think that was probably a legitimate piece of debate at any time, but especially from one lawyer to another in the circumstance.
Prepared to rule on point of order number 2. I do have the benefit of the blues. The Honourable Minister of Justice said, Mr. Speaker, it's disappointing and not surprising that that member for Calgary-McCall would seek to undermine the hard work of the men and women in law enforcement, and a point of order was raised. I think there are a wide range of times in just this week where individuals have been identified individually and opinions that they may or may not hold that vary on both sides of the House. I certainly don't think that there was anything unparliamentary about what the Honourable Minister of Justice said. I can imagine that the member for Calgary-McCall would disagree, but that is what we do here. We debate facts, and there's often two sides of both of those facts. This is not a point of order. It's a matter of debate. I consider the matter dealt with and concluded. The last point of order was called by the Honourable, the Deputy Government House Leader, the Minister of Transportation, at 2:35.
Mr. Speaker, I'll be taking this point of order if it pleases the Assembly. I rise on 23 H, I, and J. In particular, I imputes false or unavowed motives to another member. This is in response to the member from Edmonton Gold Bar when asking a question that was ultimately answered by the Honourable Minister of Service, Alberta. The member from Edmonton Gold Bar, who is no stranger to the point of order penalty box, said he values his seat around the cabinet table more than the input from his constituents. Now, Mr. Speaker, what I would insinuate from that is that he thinks the member, the honourable member, or rather the honourable minister, values a paycheck and what he would consider influence more than the input from his constituents. That is disgusting and deplorable, given their job in this chamber, Mr. Speaker, is to represent our constituents. And we all, I believe, I speak for all members, take that input very seriously. So I encourage you to rule in favor of this point of order and ask that member apologize and retract his comments.
The Honourable Opposition House Leader.
Thank you, Mr. Speaker. Mr. Speaker, I will say in this case I'm surprised that we are debating this point of order on the letters to the editor in Sherwood Park, because I would have thought that the MLA from Sherwood Park would want less discussion about constituents writing to newspapers, about getting terrible responses, about not getting heard and feeling like they do not have good representation in this chamber. Now, in this particular case, I believe the member was drawing conclusions from the letters that have been published in the newspaper, which express extreme disappointment by voters in Sherwood Park with the unavailability of their members. I would suggest that this is a matter of debate on something that is part of the public record, Mr. Speaker.
I am prepared to rule on the third point of order today, and I do find that this isn't a point of order and is a matter of debate. But what I will say is I was a bit surprised by the question because we all know that House of Commons Procedures and Practice, 3rd edition, Chapter 11, page 209, the parameters in which we ask questions during question period is that we ask a question that is within the administrative responsibility of the government or of the individual minister addressed. The Minister for Service Alberta is not responsible for the education ministry, and certainly I'm not sure what his opinion about the curriculum was government business. It seems to be a question that was significantly more constituency related than government business related, but nonetheless, this is still not a point of order. Just a friendly reminder to members of the opposition to ensure that their questions are about government business and not the individual opinion of a certain minister on any topic. I consider this matter dealt with and concluded, and it is not a point of order. Honourable members, we will now proceed to royal assent. At this time, I would ask that you please put away any laptops, computers, electronic devices of any nature, as we will have a guest joining us in the chamber momentarily, the Honourable the Premier.
Thank you, Mr. Speaker. Her Honor, the Honourable the Lieutenant Governor, will now attend upon the Assembly. Rick, excuse me.
Good to see you. Your name was whatever.
All right, please. Mr. Speaker, Your Honor, the Honorable Lieutenant Governor awaits.
Sergeant at Arms, admit Her Honor. The Legislative Assembly has, at its present sitting, passed certain bills to which, and in the name of the Legislative Assembly, I respectfully request your Honor's assent.
Your Honor, the following are the titles of the bills to which Your Honor's assent is prayed. Bill 54, Irrigation Districts Amendment Act 2021. Bill 55, College of Alberta School Superintendents Act. Bill 61, Vital Statistics Amendment Act 2021. Bill 71, Employment Standards COVID-19 Vaccination Leave Amendment Act 2021. Bill 211, Municipal Government Firearms Amendment Act 2020. These are the bills to which Your Honor's assent is prayed. In Her Majesty's name, Her Honor, the Honourable the Lieutenant Governor, doth assent to these bills.
All right, please.
Honourable members, orders of the day, orders du jour. Please be seated.
Under government motions, motion number 776, Honourable Mr. McIver.
The Honourable the Deputy Government House Leader.
Thank you, Mr. Speaker. I'm pleased to rise today and move Government Motion 76 on the order paper. Be it resolved that, pursuant to Standing Order 4 sub 1, for the duration of the 2021 spring sitting of the second session of the 30th Legislature, the Assembly must sit on Tuesday, Wednesday, and Thursday mornings for consideration of government business unless, under notices of motion or at any time before the Assembly adjourns on a sitting day, the Government House Leader or a member of the Executive Council on the Government House Leader's behalf advises the Assembly of the morning sittings that are no longer required. Mr. Speaker, I hope the addition of morning sittings for the remainder of the spring sitting will assist with members the time they need to debate government legislation. I know this presents some logistical challenges for members with lots of meetings being scheduled in the mornings, but I'm sure we can work to overcome that, and I hope all sides are prepared to do what is necessary to allow proper time for debate in this chamber.
Honourable members, Government Motion 76 is not debatable pursuant to Standing Order 4.1. Having heard the motion as proposed by the Honourable the Deputy Government House Leader, does the Assembly agree to the motion? If so, please say aye. Aye. All those opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered.
Under government bills and orders for second reading, Bill 68, Election Statutes Amendment Act 2021. Honourable Mr. Madhu.
The Minister of Justice and the Solicitor General.
Thank you, Mr. Speaker. It is my pleasure to rise to speak to second reading of Bill 68, Election Statutes Amendment Act 2021. As every single person in this chamber knows, the people's voice is the cornerstone of our democracy. And as elected officials who represent the voices of our constituents, we must do what we can to ensure their voices are heard. One way to do this is through referendums, which is direct democracy in action. Referendums strengthen democracy in our province. This is why, last year, we amended the Referendum Act to allow referendums on government-led initiatives or matters of public interest before they are implemented. Prior to that, Mr. Speaker, referendums were limited to constitutional matters. However, this government was elected on a promise to deliver substantial democratic reform, and that's what we have done through Bills 51 and 52. Mr. Speaker, another promise made and another promise kept. And so today we are taking another step to strengthen democracy in our province by ensuring Albertans can hear all viewpoints during a referendum. Bill 68, Election Statutes Amendment Act 2021, makes it clear that all MLAs, including ministers, in their roles as MLAs, can express their own views on topics of referendums. As a diverse province with a wide spectrum of opinions, it is important that the people that Albertans elect to represent them can participate in a robust public, healthy debate about issues impacting the future of the province and its citizens. This will help Albertans in deciding which path we should take to best meet their current and future needs. This amendment is simple but important, and I urge all members to support this change. Mr. Speaker, this bill would also update the Education Act to allow for the expansion of eligibility criteria for trustees in Francophone regional school authorities. This change is necessary as it addresses inadvertently restrictive eligibility criteria for potential trustee candidates. This includes prohibiting those without school-age children to run for trustee positions in local Francophonie elections. If passed, this new criteria will be in place in time for the October elections. Mr. Speaker, this proposed amendment follows consultations and conversations with stakeholders who support this amendment to the Education Act. And our commitment to the Francophonie school community does not end there. We will continue to engage Francophonie School Board trustees, parents, and other impacted stakeholders on future eligibility criteria to make sure we've got the right criteria in place. With that, Mr. Speaker, I move second reading of Bill 68. And with that also, Mr. Speaker, I move to adjourn debate on Bill 68.
Thank you, Honourable Minister. Having heard the motion to adjourn debate on Bill 68, all those in favour, please say aye. Aye. Any opposed, please say no. That is carried.
The government bills and orders for second reading. Bill 65, Health Statutes Amendment Act 2021. Adjourn debate on amendment. Mr. Ellis.
Thank you, honourable members. We are, I believe, on referral amendment 1 for everybody's benefit, or REF1. And I see the honourable member for Edmonton City Centre has risen to debate.
Thank you, Mr. Speaker. I appreciate the opportunity to rise and speak to Bill 65, the Health Statutes Amendment Act. Once again, we have a number of pieces of health legislation in front of us in this session. It certainly keeps me busy as the official opposition critic for health, but I'm pleased to say that in general, this bill does not follow the pattern of previous legislation by this government. That being the pattern of continuing to undermine our public health care system and put it at risk in name of their own political ideology and seeming fixation on pushing more and more private profit in the midst of our public health care system. This bill, however, does not continue on that pattern, which is a refreshing change for Albertans. What we see in this bill today is a few basic changes to a few different pieces of healthcare legislation, and then one piece which seems odd that it's included here, and which I may speak on, likely will speak on at more length, as I think it is largely the reason why I would be supporting this motion for referral. Now, what we have in this legislation is some changes to the Alberta Evidence Act, and so that's to provide judges that they're at fatality inquiries with access to information from the health systems quality assurance committees to help support more comprehensive reviews and better recommendations. I see no reason to object to that, Mr. Speaker. That seems reasonable to me. Indeed, if judges are conducting a fatality inquiry, we want them to have access to all of the most important information that they need to be able to make a fair ruling. And I understand this amendment was in fact based on a recommendation from 2 judges from previous inquiries. And according to our health officials, it in fact does bring Alberta in line with the other major provinces. So looking at this particular provision, I don't see a particular reason for concern here. In regards to the changes to the Health Professions Act, we do see some changes involving pharmacists and pharmacy technicians, and their ability to treat herd animals. So I do know a little bit about veterinary medicine, not because I've personally practiced, but because I do have a brother-in-law who is a very capable veterinarian and very capable businessman who runs the Vermilion Veterinary Clinic and has run that for a number of years, as well as has run some satellite clinics in that area. So certainly I appreciate the good work that he does there. Frequently have the opportunity to chat with him about some of that work. Certainly it is back-breaking and demanding work, and I mean that quite literally. My brother-in-law indeed does have back issues from some of the work having to do with preg checking and some of those works on cows. Very physical work, Mr. Speaker. But I admire and respect the work that he is doing and so many other veterinarians across the province. In this particular situation, what we have are pharmacists being allowed to supplement the work that is done by veterinarians across our province. What we have appears to be basically a legislative fix. This was required when another act was previously amended back in 2018. We had federal legislation under the Food and Drug Act, which was amended, and unfortunately disallowed pharmacy services from being able to provide the support for farmers that have herd animals, unless they're expressly allowed to do so under provincial legislation. So this piece here in Bill 65 is essentially just enabling that piece. So basically when this legislation passes, we'll return to the status quo that was in place under our government that was just sort of shifted by this change in the federal legislation and bring things back around so that pharmacists and pharmacy technicians can work hand in hand with farmers, ranchers, and indeed with our veterinarians to make sure that everybody is able to provide the best service. And my understanding is the Alberta College of Pharmacy is supportive, and that indeed the Alberta College of Veterinarians has also expressed their support. So I see no reason to object to this portion of Bill 65. We have some additional changes in regards to pharmacies under the Pharmacy and Drug Act, some modernization of the way the Alberta College of Pharmacy oversees pharmacy operations and practices. Now, it's my understanding, after my briefing with officials and having had a chance to look at the legislation, that the situation we have is that there simply are ways that I guess pharmacies are set up, different corporate arrangements, different ways, different ownership structures for pharmacies. And right now, some of those are not, in fact, named or covered within legislation. So the amendments that are come forward, and I understand that these amendments have the support of the College of Pharmacy. Indeed, the government was quoted the president of the Alberta College of Pharmacy in the news release, simply moves these pieces out of regulation into standards that are set by the college, which therefore makes it easier for them to accommodate different ownership models and different approaches that individuals may take in how they set up their pharmacies and allow them to be represented then in the law and just reflect what is basically already happening in practice. And I would join with the health minister who spoke earlier today in praising our pharmacists and recognizing the contributions they are making in our vaccination process. I had the opportunity to go and get my own jab in the arm this past Tuesday at my local Loblaws pharmacy, who had a walk-in clinic. It's been wonderful to see the pictures coming in from colleagues on both sides of the aisle who themselves have been taking this opportunity to go out and get their injection. And to the perhaps tens of Albertans that are tuned in this afternoon, I would encourage them, if they're eligible, to also go out and get their vaccination. Albertans 40 years of age and up, of course, are eligible now to get the AstraZeneca vaccine, which we know is scientifically safe and proven, and not really a subject of research, as has been opined by at least one member of this assembly. That said, I see no reason to object to this particular piece of Bill 65, and so that would have my support. Moving on, we have some changes to the Crown's Right of Recovery Act. So these are sort of the two, I think, most consequential amendments to this act. First of all, we have a provision added so that when the government joins in an injured claimant's lawsuit that ultimately ends up being unsuccessful, the government of Alberta is only responsible to pay the additional reasonable costs that are related directly to recovering the cost of health services that are provided to the injured claimant. My understanding is this is a standard that's already currently in place in both Ontario and British Columbia, so it does not seem objectionable there. But the second piece is one that did raise some questions as I was looking through this bill and sort of noting that this was here, and particularly as it seems to relate to Treasury Board and Finance, but yet is present in this piece of healthcare legislation. And this is a section here that removes an automatic fine that's in place for automobile insurers who fail to submit their annual premiums report to Treasury Board and Finance. So this would basically empower the Minister of Finance to have discretion on whether or not to apply that fine. This strikes me as this amendment as a solution in search of a problem. When we had the chance to speak with ministry officials about this particular piece, there did not seem to be that this was at any point a significant problem within the province of Alberta, or that there had been any significant impediment to having an automatic fine in place. I don't recall that they were able to offer a particular situation where that provided a significant problem for either the government or an insurance company. The example that was given, and they offered this as a hypothetical, was that, well, what would happen if the chief financial officer of an insurance company unexpectedly died right before the filing deadline? But to my knowledge, this has not, in fact, actually occurred. Now, this apparently is in the health statutes bill because the amount of the premiums that are collected and reported to Treasury Board and Finance is then used by the Ministry of Health to determine health premiums that are charged on auto insurance packages. So a little bit convoluted, but fair enough. That's why it's present in this piece of legislation. But I think there are fair questions to ask. How does this change, in fact, actually benefit Albertans? We've seen under this government, that unfortunately they rolled over quite quickly in terms of allowing auto insurers in the province of Alberta to drastically hike auto insurance rates for Albertans. We have, I think every one of us in this House has probably heard from our constituents about the significant increase they have seen in their auto insurance over the last couple of years. Now, of course, this is on top of all the other ways in which this government has made life much more expensive for Albertans. From going back on their promise that they would not charge Albertans more income tax, and indeed allowing that to happen through bracket creep, something the Premier himself once vehemently decried, but is now more than happy to allow to happen under his leadership in the province of Alberta. He spoke at length the other day about how proud he was to bring forward a bill that he had first proposed when he was the head of the Taxpayers Association here in the province of Alberta. While in that same position, he decried bracket creep. And now he is the one that has brought it into the province of Alberta. So alongside the increase in auto insurance rates, that's just one of many ways this government has made life much more expensive for Albertans. And now they are making it a priority in this health care bill in the midst of a global pandemic to provide yet another way for them to let auto insurance companies off the hook. Now, whatever arguments they might have for doing so, I got to say, at least optically, this is not something that looks good to average Albertans. And if there is any reason then why I'm supporting this referral, I think it is because of this particular piece and this particular clause. We have a piece of omnibus healthcare legislation which I outlined is generally quite innocuous. Reasonable steps making reasonable changes in consultation with Albertans and those involved, but then we come across this one piece in the midst of this, which is tangentially connected to health care, but really is not providing any benefit to Albertans in terms of their health. It's certainly not providing anything helpful to them. It certainly indeed just seems to be another way that this government is perhaps doing favors for corporate Alberta, which again has been its wont from its $4.7 billion corporate giveaway to its continued sweetheart deals that it continues to offer using Albertans' tax dollars. Even while in the midst of this global pandemic, they nickel and dime and continue to be the government that acts last and acts least in terms of actually providing support to individual Albertans and Alberta businesses. But yet, they make it a priority in the midst of this health care bill, in the midst of a global pandemic, to provide this little favor to auto insurers in the province of Alberta. I can't help but think that this is just indicative again of how this government is prioritizing its corporate interests, its political interests, its friends and insiders over average Albertans. So this again is also a situation where we have the UCP government giving new powers to their ministers, and we've seen that time and again. And of course, another bill that is before this House currently is Bill 66, which is rescinding the largest power grab that we have seen from a government in the province of Alberta. And I'll speak much more about that when we arrive on Bill 66. But I reference it to note that that is the habit and the wont of this government, to provide more and more power to their ministers to do things behind closed doors, out of sight of Albertans, without consultation. Indeed, that's becoming a dominant theme, I think, of question period in this House as we talk about things like coal consultation, we talk about environment in their job, we talk about the Métis Settlement Act, we talk about so many things which this government does where it is ducking accountability and transparency with Albertans, where it is not coming clean, where it is not being straight with Albertans about their intents. And it comes at great cost then to Albertans, as I outlined, I talked about. Certainly there has been the financial impact of this government's decisions, whether it comes with the cancellation of the child care program. Their decisions now to leave so many federal dollars on the table, whether it's for agricultural subsidies, whether it's for supportive housing, potentially now on a child care program, because they're more interested in their political interests and their grudge match with Ottawa than they are about actually doing things to benefit the people of Alberta. Which again is why, though I have no objection to the majority of what we see in this bill, this particular piece is good enough reason for me to say we should be referring this to committee where we can sit down and do some of that consultation to which this government is so seemingly allergic. And we would have the opportunity to actually talk to the stakeholders involved and actually get a better sense of why they are making this particular move when there seems to be no justification, indeed a solution in search of a problem. Now, this government is certainly fond of using committees to hide and obfuscate, starting from the McKinnon panel all the way at the beginning, going through now to their sham of a coal consultation, which barely allows anyone to discuss any of the issues that they are actually concerned about with the removal of the coal policy. This government likes to give the appearance of consultation, much as we have them defending today the fact that, well, if Albertans don't like the absolutely terrible curriculum that's been designed.
Thank you, Honourable Member. 29-2A is available, and I see the Honourable Minister of Justice and Solicitor General has risen.
Thank you, Mr. Speaker. Mr. Speaker, I wanted to very quickly respond to the comment made by the member from Edmonton City Centre. And I do want to thank him because he acknowledged that this is a good bill, that the majority of the content of this bill are good and stuff that he can support. And I thank him for that because that is the right thing to do, because this is a good bill. But then, his last comment on this particular bill had to do with the Crown's Right of Recovery Amendment Act that is included in Bill 65. And the reason why he feels, he concluded that because of that, he would support the referral amendment. And now, to be clear, Mr. Speaker, the amendment that's been made to the Crown's Right of Recovery, you could sum that up in two ways, the things he's quarreling about. Limits government cost exposure to a reasonable amount directly related to its right to recover healthcare costs when it participates in an injured claimant's ultimately unsuccessful lawsuit. I know sometimes legal jargons and the complexities of legal proceedings can be difficult to follow, but it is very important that we keep in context what is at the heart of the amendment that the honourable member from Edmonton City Centre is objecting to. When an injured claimant ultimately unsuccessful lawsuit. Second piece, reduces red tape and allows government to waive late filing penalties for auto insurers in extraordinary circumstances, such as natural disasters, again, keep it in context, that prevent them from meeting deadlines to file report. This is something that we see in many legislations, that is similar to what we are dealing with here. And I just want to read, for the record, the section that has been substituted. And that is, section 2, sub 3. If an automobile insurer fails to file a report for a calendar year as required by this section, the President of Treasury Board and Minister of Finance may access against the automobile insurer a penalty calculated in accordance with the regulations. So right there is the enabling power. But then, because of these extraordinary circumstances, things that may not be in the control of the insurer or the government, there is a standard requirement that exists in many legislation that I am aware of as a lawyer. Waiver of penalty or interest, notwithstanding the Financial Administration Act, the President of the Treasury Board and Minister of Finance may waive or cancel all or any portion of any penalty or interest payable under this division, and so on and so forth. But listening to the member from Edmonton City Centre, you would think that the President of the Treasury Board of the government is out to get the insured, that we are out to get Albertans. To the contrary, the opposite is the case. This amendment has nothing to do with all that you've heard from the member from Edmonton City Centre. And I think it's important that we keep that in perspective. And so, Mr. Speaker, oftentimes we focus on politics, and I get that, rather than the substance of the issues before this assembly. And I hope that the member from Edmonton City Centre, as the official opposition health critic, would look at this particular bill, the totality of it for what it is. This is a good bill, and do not allow something that perhaps he hasn't had the opportunity to think through their consequences to color or to blur his sense of what the good that this bill is meant to do. There is nothing in Bill 65 that creates a problem for Albertans. Thank you, Mr. Speaker.
Thank you, Honourable Member. Minister, are there any members looking to join debate on the amendment? I see the Honourable Member for Edmonton Manning has risen.
Well, thank you, Mr. Speaker. I think I'm going to have to yell a little bit on this with my big mask on, but thank you for letting me rise and to speak to the referral amendment, which I appreciate the Justice of Minister's comments. And so I believe that my honourable colleague from City Centre hadn't actually gotten to the concerns around the referral amendment. Instead was trying to give some positive comments to the government in regards to the work that was being done in the bill. And again, I think that the concerns that my colleague had was going to get to and was going to bring up is around pieces that with this Health Statutes Amendment Act, because it was referring pieces of, or amending pieces of legislation, there were some gaps that were missing out of the bill that we would have liked to have seen passed over to, or added to this piece. And so that was where my honourable colleague was trying to get to, and to be honest, I am actually trying to pull up my notes right as we speak. It's not totally working, so there we go. And some of that was, we had a bill that was introduced into the legislature around the Mental Health Amendment Act, I believe last sitting, or the sitting before, where there was conversations that were happening around an individual that had been provided care in Calgary. And part of that piece of legislation, which is being amended again within this piece, this Health Statutes Amendment Act, there had been some concerns that had been brought up in regards to pieces that were missing out of that. And we'd heard from the community that they would have liked to have seen a little bit more teeth, I guess, to the Mental Health Act in that sense. And so when we see the fact that under the Health Statutes Amendment Act, there was potential that it could have been reopened underneath this piece, and that that Judge Dixon had actually recommended the modification of the Health Act and the Health Information Act because of what had happened. And so I just wanted to maybe make some comments about that. So what we have here is there was a judicial recommendation that was made in regards to the fatality inquiry led by Judge Dixon. And one of the recommendations from the fatality inquiry that was made, was recommended around the legislation, was that additional recommendations related to the tragic story of Miss Lewis, who suffered from homelessness and mental health issues. So Miss Lewis was admitted to the hospital under the Mental Health Act, and through a series of tragic events and mismanagement, it was determined that some policy and legislation needed to be changed. And so Judge Dixon had actually made some recommendations to modify the Mental Health Act and the Health Information Act so that the tragic story of Ms. Lewis would never happen again. Unfortunately, what has happened, though, and part of the reason why we had suggested that this piece of legislation not be read for the next 6 months and in fact go back, was because the recommendations that were made by Judge Dixon were actually not put into this Health Statutes Amendment Act. And so given the fact that the government chose to reopen the Health Statutes Amendment Act, it would have been beneficial to see that we have some jurisdictional rulings that are giving recommendations to the government, that those pieces of legislation, or those recommendations, would have been included in the Health Statutes Amendment Act. And so we would like to see that happen. I mean, that is specifically around the Mental Health Act and, of course, the Health Information Act, which, as we've heard from the government on numerous occasions, that, you know, mental health is a focus of this government and something that they take very seriously. And because of that, and because of the fact that they take mental health so seriously, and you know, they speak often about the work that they are putting forward, you would hope, and we would like to give that opportunity to the government to take Judge Dixon's recommendations, to look at them, and while this Health Statutes Amendment Act is open, and while there's opportunity to make those amendments, to, instead of passing it today, have it read in 6 months after the recommendations are analyzed, or maybe they already have been by this government. I mean, I'm open to hearing from the minister about that, and be implemented at the same time as the rest of this act is being implemented. Because if we're going to make amendments to health statutes, and very clearly there's been some recommendations made to address those health statutes, that we would encourage the government to open that up and to look at that so that, you know, we can move forward with those recommendations and it fits with what's happening with the government. Because I would hope that again in the next fall sitting, after potentially this act is dealt with, and however that outcome is, I will not predispose the House on the outcome, but that we're not reopening the Health Statutes Amendment or the Health Statutes Act again, or these Health Statutes Acts again, because this piece that we are identifying here today couldn't have been dealt with now. And again, if the government decides that not having this referral completed for the next 6 months is not something they want to do, but maybe the minister or the government would like to stand up and say, you know what, we could actually look at amending this in Committee of the Whole to address that concern. I think I would be open to looking at what that would look like and to have those conversations, because I think that this is an important recommendation that is being made by our judicial system. And I do believe that, you know, the unfortunate situation that happened with Ms. Lewis is something that does at some point need to be looked at and addressed. And if that's something that the government is willing to do and is willing to say, well, let's have a conversation offline around and see what we can do for Committee of the Whole to address the health statutes, that's reasonable, I think. But if the government is going to say, well, actually, we're not willing to do that today, then I think it does need to be read in 6 months, so that these pieces are being dealt with, because we don't want to see something where either we're reopening again the health statutes in the fall or in next spring, let's say. So we're reopening it all again when it can be dealt with now, or that this gets forgotten and somehow it gets missed and it doesn't get, and the recommendations being made by Judge Dixon are not implemented. And if there's concerns by the government about why they can't be implemented or what the concerns are, I think that, you know, there's fairness in that conversation as well. But there's also an acknowledgement that, you know, we don't want to see a tragedy like this happen again. And given the fact that the fatality inquiry did happen and that whole process was walked through as it should be, and that recommendations were made, I think that it's something that's reasonable to have a discussion about. So again, I appreciate what the minister was saying around, you know, is this being introduced just for the sake of stalling a bill out? No, that's not the case. And in fact, as my honourable minister was saying from City Centre, there's many good things being changed. Like, there's no question. And I think that if we look at Bill 65, there are good pieces here, but this piece is missing. And so if the government would, want to go offline and maybe have some offline conversations about why the fatality inquiry recommendations can't be dealt with today or within these statute changes, I think that that's a fair conversation to have. But as the opposition, I think our responsibility is just to flag that this hasn't happened yet. And so if it could happen under this, that would be great. If it's a matter of doing it through amendments in committee of the whole, fair. If it's a matter of we need more time, then maybe we shouldn't pass this then and wait 6 months so that it can be done, so that we're not reopening a whole bunch of health statutes again in 6 months or in, this fall sitting or the spring sitting. Because I think that ideally we're not reopening the same pieces of legislation over and over and over again. And in fact, if there's, in the words of the government, red tape that needs to be changed, we do it all at once instead of having to reopen things and reopen pieces of legislation and change one piece here and then realizing in 3 months from now, oh, there's another piece that should be changed. Or what we've changed actually isn't working the way we thought it was. Now we have to go back and rechange it again. We all know that through legislation, sometimes we change one piece and it creates a waterfall of changes in other areas that are not necessarily intended. That's just because, as we see here, one piece of legislation can actually touch on a whole bunch of other pieces. So that's in regards to, I think, the minister's questions when it comes to why we're asking that this not be read for 6 months. While I'm standing here and we are speaking about this, I do want to acknowledge the work that's being done with the Veterinarian Medical Association and the pharmacists. Again, we've heard in this House that there is a significant demand for veterinary services, not only in Alberta and not only with mixed animals, but it's a national issue, it's an international issue, it's not just specific to Alberta. And I think seeing that the pharmacists and the veterinarians are going to be able to work together in collaboration to provide services to mixed livestock or mixed animals, but also to companion animals, I think is a positive move. I have a story actually from someone that I was speaking to about this who said, this is one example of this for those of us that just have our furry friends and don't necessarily work out with livestock and have to deal with those complexities. But, you might have someone who decides to go on a trip with their furry friend and take them with them and then realize that they haven't brought their seizure medication because some animals are on seizure medications. And so this is an opportunity where, you can call your vet and say, I forgot, Fido's seizure medication for the weekend that we're going to be away. And they can, get that prescription filled at the local pharmacist for the weekend hike. That was like the simplest explanation that was given to me that totally made sense to me. Obviously, there's far more complexity around some of the supports that are going to be provided in conjunction with veterinary services and our pharmacists, specifically around microbiological services and a whole bunch of complex services that are happening in our rural communities with our agriculture sector. And so I've heard that this is a very positive step and in fact was happening and this collaboration existed prior to the creation of the Health Statutes Act. And then when the Health Professions Act came into place, it was one of those things where we started, again, when we go back to some pieces of legislation touch each other and because of that create confusion. This was one of those things where there was a relationship with the Veterinarian Medical Association and the Pharmaceutical Association. And then the Health Professions Act came in and became very prescriptive around roles and responsibilities, and one of these pieces was that this part was missed. And the change that is being made here is again very beneficial to both professions and understanding still their roles, but being able to work more collaboratively with each other. And of course, it still provides enough of a guidance and guidelines around still the role of the veterinarian or of a vet and the role of a pharmacist, but also how they can work in collaboration. So there is a positive piece to that. And I mean, there is, when we look at that piece, you know, there is some work that is already being done outside of how vets and the pharmacists are working together, but this just makes it more concrete. And so that is a benefit. I'm sure the minister will stand up and say, well, remember, if this isn't read for 6 months, then what's going to happen? They are very aware, and they have been obviously managing this dynamic since the Health Statutes Act and the Health Professions Act came into place. I recognize this as housekeeping, and I'm very aware that the minister would stand and say that piece. However, as the government is probably aware, this is a housekeeping measure. There have been policies put in place around this already. This is now just legislating those changes. And so it's not something that would prevent the pharmacists and the veterinarians from being able to do this. So I quite enjoy being down on the lower floor now and across from the ministers, because we can actually, through our silent communication, communicate with each other. And so, you know, I will sit down and receive the rest of my time. I would be interested to hear from the minister, though, if looking at the fatality review and those pieces would be something that we could discuss offline. Oh, I didn't have that much time.
And on 29-2A, I see the Honourable Minister of Justice and Solicitor General has risen.
So thank you, Mr. Speaker. And again, I do want to thank the honourable member from Edmonton, Manning, for her comment. But again, if we carefully listen to the submissions of the honourable member from Edmonton, Manning, you would agree that there is no reason whatsoever why that referral amendment should have been made. See, she essentially agreed with this bill. There are things she would like to see in the bill, but there is nothing in this particular bill that she disagrees with, other than one or two things she would like to see. And, you know, with respect to the changes that have been made to the Evidence Act, a statute that I know too well, that I'm responsible for, except for that particular subsection 9.2, that the Minister of Health is responsible for. That amendment, you know, again, contrary to the views expressed by the honourable member from Edmonton, Manning, that amendment is being made because it was a recommendation of the justices, the two justices of the Court of Queen's Bench who presided over a fatality inquiry. And so here we are, actually putting in place in the legislation the recommendations of two justices of the Court of Queen's Bench, and supported by the profession, supported by the CPSA, and in fact, I can inform this particular assembly that I took the extra step to actually contact the CPSA to confirm for me that this indeed is acceptable to them, and they said yes. So I mean, you can see that there is no reason whatsoever for that referral amendment. There is no aspect of this particular bill that should be a concern, and that sometimes is what concerns me about our friends on the opposite side. If something does not fit 100% into, and with all due respect to them, 100% into their philosophical worldview, their first instinct is to object. No, we're not going to agree. There are times when compromise is not a bad thing. There are times when you let go, you know, for the sake of the greater good. And this bill represents the greater good of Albertans. That's what this bill is meant to do. Amend 6 pieces of legislation As you listen to the member from Edmonton City Centre and now the member from Edmonton Manning, you ask yourself, why the referral amendment? To be clear, the amendment that is made to the Pharmacy and Drug Amendment Act will clarify the accountability requirement of all pharmacy ownership models to increase compliance with pharmacy legislation, regulations, and licensing, helping to ensure the pharmacy system continues to operate safely, amongst other good stuff, good things in there. The Health Professions Amendment Act, as the honourable member rightly noted, enables pharmacists and pharmacy technicians to continue offering professional pharmacy services, supporting animal health. That's a good thing. I've already spoken to the amendment to the Alberta Evidence Act and the Crown's Rights Recovery Amendment Act. The Mental Health Act, essentially minor housekeeping changes. Right. Makes minor housekeeping amendment to correct section references, revises overly broad wording regarding retention forms to be more specific to what Alberta Health Services can report on, deletes unproclaimed sections of the Mental Health Amendment Act. Those are the changes here, nothing controversial. And so it is my expectation that our friends on the opposite side would see the greater good in this particular Bill 65 and vote, accordingly. Mr. Speaker, again, the member from Edmonton City Centre is the health critic, and he knows too well, if we are to be blunt and honest to ourselves, that there's nothing to fight over this particular bill. Let's simply accept that and move on. Thank you, Mr. Speaker.
Thank you. With about 8 seconds left on 29-2A, seeing none, are there any members looking to join debate? And I see the honourable member for Calgary East.
Thank you, Mr. Speaker. I rise to oppose the amendments to Bill 65 as proposed. Bill 65 is a critical bill that will ensure modernization, efficiency is maintained in our healthcare system. If we choose to delay this important legislation now, then Albertans will be the ones facing unnecessary challenges. Bill 65 is meant to help support the health professionals and ensure Albertans are being effectively supported. This in turn will benefit many of our working professionals to ensure Albertans are being effectively taken care of. I'm pleased the Ministry of Health is tabling 6 important pieces of legislation under Bill 65, the Health Statutes Amendment Act 2021. Before going further, let me thank the Minister for Health and the thousands of frontline healthcare workers for supporting and protecting Albertans who have faced by the challenges of this pandemic. I would like to further extend my appreciation to the Premier and Health Minister for working hard. I appreciate the efforts that have been contributed to keep Albertans safe. I sincerely appreciate the government's willingness to help for the effort and extra time contributed. Again, thank you for the confidence and support. I'm grateful for healthcare system and all professionals for being resilient during these unprecedented times. A comprehensive review of Alberta Health Services, AHS, was conducted in 2019 by independent contractor Ernst & Young, EY. AHS is the provincial health authority responsible for planning and delivering health care to more than 4 million Albertans. AHS provides the best possible care at every facility, and Albertans receive good value for their money. An overwhelming 90% of AHS staff survey respondents agreed that protecting and strengthening the sustainability of Alberta's health system should be a key AHS priority. The review is part of our larger commitment to improve access and make the health system work better for patients. This involves finding savings and investing them back into the system so we can make Alberta's health system one of the best in the world. Mr. Speaker, the proposed amendments will be making effective amendments to ensure that all Albertans are being protected and supported by our healthcare system. Mr. Speaker, I'm pleased that Alberta's government is increasing health budget by over $900 to $23 billion, excluding the impact of COVID-19. $5.4 billion for physician compensation and development, $3.5 billion for community care, continuing care, home care programs, $1.9 billion for drugs, supplement health benefits, $34 million for supports to expand mental health and rehabilitation, services for children and youth, and $140 million over 4 years for mental health and addiction services. Mr. Speaker, Albertans continue to fight against COVID-19, and the budget 2021 continue to support Albertans as we enter the second year of the pandemic. An additional $1.25 billion has been made to address healthcare costs for responding to the pandemic, including surgical wait times and backlogs. As we all know, the cases of COVID-19 have risen drastically in the past few weeks, and as a result, we need to focus on ensuring we are able to bend the curve and slow the spread of the virus. We have the best vaccine program in Canada with more than 734,000 doses administered by mid-April. We expect to have 22% of Albertans protected from COVID-19, and by the end of May, by the end of June, it's 64%. Mr. Speaker, I'm glad that over 1 million Albertans have now received at least one dose of vaccines, helping protect them from severe outcomes and reduce the spread of COVID-19. We are expecting to see a decrease in the number of cases. As we have vaccinations rolled, we can slowly move past step 1 of the COVID-19 path forward to plan. Mr. Speaker, pharmacists have historically provided pharmacy services to support animal health and was previously enabled under the Food and Drug Act until changes were made by the federal government. The Health Professionals Amendment Act will be introducing amendments to the profession of pharmacists and pharmacy technicians of the Health Professions Act and would enable access to pharmacy services for herd animals and clarify that pharmacists and pharmacy technicians are able to provide pharmacy services to companion animals. This provides Albertans who raise animals with options will be able to access prescription drugs for their animals. This will once again allow pharmacies to provide services that were previously enabled under the Food and Drug Act prior to changes made by the federal government. Mr. Speaker, this is an important change for Albertans and will provide greater choice when seeking to access to professional pharmacy services to support animal health. Pharmacy and Drug Amendment Act will provide Albertans with more accountable, more modern pharmacy service that offers greater protection for patients while also reducing red tape for the pharmacy system, enhancing pharmacy owner responsibility and accountability for legislative, regulatory, and licensing requirements to ensure all pharmacy owners, regardless of the ownership model, are accountable for the care the pharmacy provides to Albertans. This would enable the pharmacy system to continue to operate safely, efficiently, enhance responsibility, accountability for pharmacy legislations, regulations, and licenses, ensuring pharmacy owners are accountable for the care the pharmacy provides and enabling the pharmacy system to continue to operate safely and efficiently. Mr. Speaker, certain operational necessities from regulations will be standard of practice instead of regulations. This will be the first step as amendments to the pharmacy and drug regulations are required to enable these operational changes and will require for physical facilities, pharmacy areas to following standards of practice. Albertans want to create an even safer, more efficient and accountable pharmacy system that is responsive to rapidly evolving pharmacy practice, and these changes will highly benefit our healthcare system. Mr. Speaker, as we know, fatalities inquiries in Alberta are ordered by the Minister of Justice and Solicitor General, allows recommendation from the Fatalities Review Board, which then the board reviews the conclusion of an investigation by Alberta's Office of the Chief Medical Examiner. In some cases, Mr. Speaker, there can be reluctance among medical professionals to critically review each other's work in the aftermath of an adverse event in care, if the review is not done in confidential manner. In order to encourage health professionals to report adverse events or issues that need improvement, governments and courts have developed privileges to protect the admissibility of information and options developed in the peer review process. These privileges are authorized in the Alberta Evidence Act. Alberta Evidence Amendment Act will as well improve transparency and ensure judges at fatalities inquiries have better access to the facts and recommendations from internal reviews undertaken in healthcare settings. The amendments will reflect only allow for the following to be released to fatalities inquiries, logistical and factual information about a quality assurance committee, information that was already disclosed to the patient's close family, and other facts relating to the incident being investigated, and no options or individually identifying information other than information that identifies the deceased can be shared. Mr. Speaker, under the Crown Rights of Recovery Amendment Act, the Alberta government will have the right to recover healthcare costs experienced when Albertans are injured due to someone else's wrongdoing, without facing the risk of full court and legal costs from unsuccessful lawsuits. Additional provisions will allow the government to join an injured claimant lawsuits, but will only be responsible to pay the reasonable cost related directly to the health services provided to the injured claimant. Mr. Speaker, as we know, this past year has been difficult for everyone. Faced with increased isolation and lack of community support, many Albertans have felt that their mental health has been negatively impacted. Albertans have been forced to adjust to a new normal. For many, it means setting up an office at home, attending online school, or meeting with loved ones virtually. Mr. Speaker, this has been our new normal, but that doesn't mean it is ideal. While we look forward to the gradual return to how things were before, we need to acknowledge the challenges that Albertans currently face, particularly in maintaining their mental health. The Mental Health Act will continue to ensure the rights of mental health patients are respected and that Albertans receive responsive, accessible care. These changes will allow the reduction of red tape and will improve the efficiency and supports that are in mental health care system. The proposed administrative amendments to the Mental Health Act will correct section references, revise overly wording in relation to the detention forms, and will continue to ensure the rights of mental health patients are respected and that Albertans receive responsive, accessible care. Lastly, the Alberta government is making minor housekeeping amendments to the Health Facilities Act to remove outdated references. The government is removing references to local welfare officer since such positions no longer exist. Changes will also ensure the government continues to have the appropriate authority to enforce rights under the Crown's Right of Recovery Act. The legislature will benefit everyone affected that are targeted and will create awareness and support for families and patients. So, Mr. Speaker, once again, today I encourage everyone in this chamber to support the bill and support all Albertans in our outdated healthcare system. This will timely help our hardworking healthcare professionals and Albertans to receive the benefits they deserve. Mr. Speaker, again, Bill 65, the Health Statutes Amendment Act, will create a more responsive health system that can better meet the needs of patients. Again, I applaud all Albertans, Premier, Minister, and the team members that have been involved in making of these changes, and of all their efforts that will ensure the efficacy and safety in our communities. Families and patients are always maintained. Thank you, Mr. Speaker.
Thank you, Honourable Member. 29-2A is available for quick questions or comments. Seeing none, are there any members looking to join debate? I see the Honourable Member for Edmonton West Henday has risen.
Well, thank you, Mr. Speaker. It's an honor to rise this afternoon to speak to what is before us, of course. Just to remind you, the member from Edmonton-Glenora has moved that the second reading of Bill 65, the Health Statutes Amendment Act 2020, be amended by deleting all of the words after that and substituting the following, that the Health Statutes Amendment Act be not now read a second time, but that the subject matter of the bill be referred to the Standing Committee on Families and Communities in accordance with Standing Order 74.2. And I agree with my colleagues that this is an important step to take. While there are several pieces within Bill 65 that I can see myself supporting, and many members of the opposition have spoke to the importance of moving those concerns and those amendments forward. Mr. Speaker, the fact is what we have before us in some respects is amendments that are being done to a piece of legislation that we saw not that long ago before this House, and in some instances concerning or in reference to changes regarding judicial recommendations from the fatality inquiry led by Judge Dixon. These were things that we were calling for when that piece of legislation came before the House earlier in this session, and unfortunately at that time the UCP government, the Premier, the Health Minister did not want to listen to our recommendations, though they are very important ones. And so while I reflect on what we're seeing in this legislation, specifically around those judicial recommendations. I'm supportive that we see parts of that implemented through these amendments, but unfortunately, only one of those recommendations from that fatality inquiry, have actually made it into this legislation. Of course, as you may remember, Mr. Speaker, Judge Dixon's fatality inquiry made a few other recommendations related to the tragic story of Miss Lewis, who suffered from homelessness and mental health issues. Our system failed that person, and unfortunately, all of those recommendations that were put forward are not being implemented in here. And so once again, while I can appreciate that we're seeing, in part, some of that work moving forward, as we called for when healthcare changes were initially brought forward to strengthen the system. Unfortunately, not all of them are included in this, and I question, just like many members in the opposition have up to this point, whether we are going to find ourselves back in here trying to implement these other recommendations in the future, and why aren't we taking the time to properly address those issues and ensure that those amendments are done properly the first time through. And of course, we've seen this, Mr. Speaker, on other pieces of legislation. Even before the House right now, we see changes to prompt payment legislation. We see changes to the administration and bylaws of real estate councils in our province. And unfortunately, those pieces that came before the House a very short while ago are now before the House again. And so I would encourage, I suppose, while I do not support the position of the Associate Minister by any means, that if this government is going to be spending $10 million on an Associate Minister of Red Tape, that maybe that minister do a better job of consulting with his colleagues and ensuring that they're reducing the red tape that they are themselves creating in this Assembly and the cost of that. Now, once again, as I reflect on the amendments that we see here and support some of these changes, the fact is, Mr. Speaker, Albertans are looking for answers on the election campaign commitments that this government made, specifically around getting those Albertans back to work who continue to struggle through this third wave of the pandemic. They've been waiting for at this point, years for this government to put forward anything substantial that would support those members of the public to get back to work. And unfortunately, we are not seeing any reasonable timelines to address those issues. And of course, we do not see that within this legislation either. And instead, what we've seen from this health minister and this government is an unwillingness to work with doctors to the point of actually fighting in public with physicians across this province, both in major municipalities and in rural communities. And in many instances, we are actually seeing those rural physicians making the decision because of the unwillingness from this government to work together. Those physicians are actually making the unprecedented move to leave our jurisdictions entirely. And they are putting it flat at the feet of this UCP government in those letters that they're putting out to their patients and to their constituents while they're planning to leave the province. And while I hear the government moaning and groaning about the fact that this is happening across our province, the fact is the fact, Mr. Speaker, that this is happening, and we are seeing those letters week after week coming forward. And it's unfortunate that for a government that has many members representing those rural communities, that it's been virtually silent on those issues. Now, we've seen in previous pieces of healthcare legislation this government moving forward to implement American-style healthcare, increasing the cost of doing business in the province, and in many instances actually reducing the amount of funds that physicians are able to take in for the very important work that they do, especially in the midst of a pandemic where the health and well-being of their constituents are most important. But, Mr. Speaker, the fact is there are many other issues within this piece of legislation, and which is why it's so important that this is referred to committee, one of which is the fact that there are some major changes to how insurance fines are going to be levied, and we see that the Minister of Finance is going to have the discretion of eliminating late filing penalties for these auto insurance companies. And the fact is, once again, Mr. Speaker, that we see time and time again from this government that when it comes to supporting the interests of these multinational, in many instances, corporations, I would reflect on the fact that in the Q3 of 2020, CIBC came out with Intact Insurance's quarterly report saying, could it get any better than this, Mr. Speaker? That was the title of the report, reflecting on the skyrocketing profitability of these companies at the same time as Albertans were begging and pleading for this government to do anything to support them through this pandemic when it came to auto insurance fees. And unfortunately, instead of any real support to those Albertans, we saw this government instead remove the cap on insurance premiums, which is absolutely horrendous in my opinion, Mr. Speaker. We have continued to see no real support on that front, and the same goes when we look at utility fees, that this government made the decision to give interest-free loans to these utility companies. At the same time, Albertans were asking for support, and the only thing that they got was a short-term deferral of those utility costs. And of course, Albertans are expecting more from this government, and unfortunately they are not getting that in this legislation, which is why I will be supporting the referral to committee once again as put forward by the member for Edmonton-Glenora. So with that, I'll keep my comments short. I appreciate the opportunity to rise, but at the end of the day, there are major issues within this legislation that should be referred to committee so that we can properly make sure that the amendments are the right ones moving forward. Thank you.
Thank you, Honourable Member. We are on REF1, just to remind everybody. And we are also at a 29-2A. Should there be any questions or comments? Seeing none, are there any members wishing to join debate on REF1? Seeing none, I am prepared to ask the question. On the amendment as proposed by the Honourable Member for Edmonton-Glenora, all those in favor of REF1, please say aye. Aye. Any opposed, please say no. No. I believe the noes have it. That is defeated. We are back onto the bill, Bill 65, Health Statutes Amendment Act 2021. Are there any members looking to join debate? I see the Honourable Member for Edmonton Beverly Clairview has risen.
Thank you very much, Mr. Speaker. I'll endeavor to remove one of these to make myself a little more audible. It's my pleasure to rise and speak to Bill 65, the Health Statutes Amendment Act. I think many of my comments echo my colleagues who have spoken before me, and so I won't belabor any of the points, but just want to get on the record for this bill, Mr. Speaker. This is my first opportunity to speak to it. I do think that there are some important changes in this bill, and then there are a couple of flags that I have or concerns that I hope the minister will address and possibly even put forward an amendment. If not, I'm sure it'll be coming from our side of the House, but would love to look at how we can improve this bill a little bit further. So to start off, Mr. Speaker, I appreciate the fact that this bill amends several different pieces of legislation. The fact of the matter is one of the areas that I think was really good collaboration, quite frankly, between our pharmacy professionals and as well with our veterinarians was, again, the ability to for pharmacists and pharmacy technicians to treat companion animals. I think this change will be celebrated mostly, quite frankly, in rural and remote parts of the province, where now we're expanding the ability of pharmacists to take care of our little furry friends. And I appreciate, or at least my understanding anyways, that the Veterinarian Association of Alberta is also on board with this change. So that's one positive change, Mr. Speaker. As far as modernizing the way the Alberta College of Pharmacy oversees pharmacy operations and practices, we know that these changes are supported by the College of Pharmacy, and so I do appreciate that. This is clearly an example that the government did in fact consult with them and take these proposed changes to them, which is greatly appreciated. I recognize the fact that the government will claim they do that in all situations and circumstances, but rest assured the opposition is always here to do our job, to hold the government to account, and also to engage with the very same stakeholders. Because sometimes I think the government might be a little overzealous with what they think is positive feedback when in fact it's not. A great example of that is the curriculum rewrite, where I have yet to find a single constituent who is celebrating that, Mr. Speaker. But at least here that they have discussed or consulted with the college. So that's good. There's a number of other minor changes which I have no concerns with, Madam Speaker. The only concern I have, and my colleagues have brought this up, but it's the fact that late filing penalties for insurers is included in this bill. Now, I do find it interesting that that's thrown in there. I think it's a bit of a stretch. I mean, this bill is now borderlining on a now I'm blanking on the term, on an omnibus bill. Thank you to my colleagues. But I did want to say, now I appreciate the Minister of Justice, who's been very eager to participate in this debate today, which is always appreciated, has spoken to an example of when insurers may file late, for example, a natural disaster. Now, I can appreciate that. That absolutely makes sense to me. My question and concern is, how are Albertans and us as legislators ensured that this power will not be abused, that it will not be used more often than in those extraneous circumstances? Because currently, as the bill is written, that's not collared. That's not specifically written of under these circumstances, and let's list them, when they can in fact file late. I think that would provide Albertans with more certainty, knowing under what circumstances can those filings be late. Because, Mr. Speaker, the official opposition was elected to do our job, which is to ensure that there is oversight over what the government is proposing, but also that there are checks and balances. And so I will put it out there that I would love for the government to look at how they can close this and address it, because I think it is a valid concern that anytime pieces of legislation give ministers broad sweeping powers, there is cause for concern. And I know for a fact that the members of government who were in the benches when they were opposition and we were government brought up and raised the exact same concerns. Whenever there were broad sweeping powers granted to a minister through legislation, they would say, let's put a collar on this. There's a concern. I know in my first term, between 2012 and 2015, a number of occasions where I had raised that exact same concern when broad sweeping powers were granted. So with that, Mr. Speaker, I think I'm going to close my comments. I know that we have more robust debate coming in Committee of the Whole, as well as hopefully an amendment that may address this under the specific circumstances that they may be able to file late. Again, recognizing that there are times and circumstances which may warrant that, but not providing a pathway to allow those that may wish to try to abuse this extraordinary circumstances to become a regular habit, which of course would not be good for I think for transparency and also for to ensure that Albertans are or that these companies are complying with rules that they should. And so my final comment, Mr. Speaker, is earlier the Minister of Justice had referred to this as red tape. Filing a report, I don't believe, is red tape. I believe that's accountability. And the insurance companies having to file their reports to the government and directly to the Minister of Finance is part of their responsibility. The same way that companies file reports to their shareholders because they are ultimately beholden to their shareholders. So this isn't red tape. This is a matter of oversight. Now, again, there are certain situations that may warrant a delay or an extension to be able to do this, like natural disasters, which is completely understandable. Then I'm hoping that we will be able to amend this to specifically state under what circumstances those may be. So thank you very much, Mr. Speaker, and with that, I'll take my seat.
29-2A is available. Should anybody have any questions or comments? Seeing none, are there any members looking to join debate? I see the honourable member for Edmonton Northwest has risen.
Well, thank you, Mr. Speaker, and thanks for the opportunity just to say a couple of words this afternoon in regards to the Bill 65, the Health Statutes Amendment Act. And, I can see generally that this is pretty straightforward legislation that is both has some utility and helps to perhaps deliver health care in the best way possible here in the province. And so, one thing a couple of things I just wanted to point out, though, is first of all, in regards to trying to characterize reforms or adjustments that we learn from the field in generally around healthcare or any other subject, really, and then talking about this as being red tape somehow, all right? This is a mischaracterization of the statutes that we see being changed here, and I think it's a mischaracterization of the work we do in the legislature generally, because we are here to make sure that we're providing regulation and to ensure the health and the safety and the prosperity of Albertans. And in fact, the definition of building law and changing and having it as an evolving process is the cornerstone of what makes a legislative process work. And, certainly I don't think anyone on the opposite side would suggest that any of these adjustments to the at least 5 different pieces of legislation or even more would be considered to be making life more difficult or onerous for Albertans, but it is making regulation to make sure that they have a modern and a utilitarian way to approach different problems. And so always I hear from this government from the beginning that, red tape reduction, they even have a deputy ministry for this, spending $10 million or $10.5 million for that. It's a normal process that takes place in the legislature. And so, I know that it's a temptation to use this word because it's an easy way to, move a political agenda along from the UCP. But let's remind ourselves, right, in a sober and reasonable way that making legislation such as this, right, is a normal process that we engage in. And quite frankly, it's our job. And, the idea of making life more difficult by creating legislation is a misrepresentation of what we do here in the legislature. The one area that, again, it's always a temptation for, by having so many different amendments into one piece of legislation that it can grow beyond the size and the scope of what it should be talking about. And the one area that I think we do need to perhaps pursue more in depth with the minister and for the government to explain is why and how we are including auto insurance into this bill. Now, maybe this auto insurance issue needs to be dealt with in some shape or form, but whenever I see legislation and something's tagged on to the end, right, almost like an appendage to the legislation, there's a certain theme, unity of theme in Bill 65, except for this one area around auto insurance. And so, I think that we would like to pursue that in a constructively critical way through the committee of the whole process, and and find maybe that there is a reasonable explanation why it should happen, number one, and a reasonable explanation why it should happen inside of this bill at the same time. Because, Mr. Speaker, sometimes you can create amendments, and you add so many amendments into something, and you have, let's say, 5 or 6 or 7 things that really need to get done. And then suddenly, the pot gets poisoned by having one thing that just doesn't make sense on the end, right? So that's why we have the amendment process. We'll work through committee of the whole, and I think that we have a way to constructively move forward on Bill 65. And so thank you for my opportunity to say a few words, and I will cede the floor to anybody else.
Thank you, Honourable Member. 29-2A is available. Seeing none, are there any members looking to join debate? Seeing none. Seeing none. The Honourable Minister of Health has moved second reading of Bill 65, Health Statutes Amendment Act 2021. Does the Assembly agree to the motion for second reading? All those in favor, please say aye. Aye. Any opposed, please say no. That is carried and so ordered.
Bill 65, Health Statutes Amendment Act 2021 is now read a second time.
I see the Honourable Minister of Justice and Solicitor General has risen.
Thank you.
Deputy.
Thank you, Mr. Speaker. Mr. Speaker, I do want to thank all members of the Assembly for a spirited debate that we've had today on several pieces of legislation. Mr. Speaker, with that, I do want to move that the Assembly adjourn until 1:30 p.m. on Monday, May 30, 2021.
Thank you. All those members in favor of the motion as proposed by the Honourable Deputy Government House Leader, please say aye. Aye. Any opposed, please say no. That is carried. The Assembly stands adjourned until Monday afternoon, May 3rd at 1:30 p.m.